You're all set? I'd like to call to order the special board meeting Monday, October 19th, 2020. I would entertain a motion to suspend the rules by Rita Curran, seconded by Mr. Fay. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Roll call, please.
Reagan.
Aye.
Forsythe.
Here.
Lightfoot.
Here.
Sheridan.
Here.
Smithers.
Here.
Denisha.
Here.
Perkins.
Here.
Akers.
Here.
Fay.
Here.
Haggard.
Here.
Piacco.
Here.
Burke.
Here.
Arquette.
Here.
Carbonelli.
Here.
Curran. Here. 15 present.
Thank you. Is there a motion to approve the agenda? By Mr. Perkins, seconded by Ms. Curran. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Arquette.
Thank you, Mr. Chairman. I'd like to offer a resolution approving federal aid highway project for the construction inspection phase of the St. Lawrence County replacement of the Depot Street Bridge project, bin 3220850, pin 775386, and I move for its adoption.
Is there a second? By Mr. Akers. Any discussion?
Don is here.
Mr. Arquette.
Thank you, Mr. Chairman. I'd like to thank Assemblyman Billy Jones, Senator Joe Griffo, Congresswoman Elise Stefanik. I'd like to thank Don Chambers for all of the hard work, the quick response. When this bridge red flagged and went down, it immediately put a couple small businesses in jeopardy, a humongous inconvenience to many of our citizens across the county. Because the route around it was great. So it's with great appreciation that I bring this resolution forward. Thank you.
Thank you, Mr. Arquette. Anyone else? Mr. Chambers?
Yes, yes. Well, the Depot Street Bridge, as Mr. Arquette stated, has been closed down to a red flag, which it makes quite an inconvenience for the folks in the area and also for commerce through that area, as it is widely used as a truck route as well. The intent is here is to, if we get approval, is to go to bid as soon as possible with this approval this evening. So thank you for the special board meeting so we can do that. And with an anticipated bid opening of December 9th, and hopefully we can do a special board meeting on December 21st for award, so that we can actually, so we can get this underway in the 2020 calendar year as New York State DOT would like us to do.
Thank you. Anyone else? Mr. Chambers, I have a question. Is there any idea what the estimate or where the estimate is on the cost of replacing this bridge?
Mr. Lightfoot, usually at this point, we keep the estimate confidential during the bidding process, but it's something that certainly I could share with the board offline at this point.
Okay, thank you, sir.
Thank you.
Anyone else? Seeing none, all in favor?
Aye.
Opposed? Carried. Mr. Sheridan.
Thank you.
Thank you.
Mr. Chairman, I'm sorry to say that I misplaced that resolution.
Well, it's a resolution authorizing an intergovernmental transfer for an upper payment limit and modifying the 2020 budget for community services.
And
Would
I
you
move
move-
for its
move-
adoption,
All
sir.
right, is there
A couple
second?
other guys haven't a resolution either, so
You don't have it
I
either?
looked all over and couldn't get any help.
Voila.
Okay.
Seconded by Mr. Reagan and Ms. Curran. Is there any discussion? Seeing none, roll call, please.
Lightfoot.
Here. Yes,
Sheridan.
Yes.
it's been a long day.
It's only one day.
Denisha.
I know.
Denisha.
Yes.
Perkins.
Yes.
Akers.
Yes.
Fay.
Yes.
Haggard.
Yes.
Diaco.
Yes.
Burke.
Yes.
Arquette.
Yes.
Terminelli.
Yes.
Curran. Yes. Reagan.
Yes.
Forsythe.
Yes.
15 yes.
The resolution is carried. Is there any further business to come before the special board meeting tonight? Seeing none, we're adjourned.
Yes, and Kelly sent it out in an email. Miss Kelly sent it out in an email.
Call the October Operations Committee meeting to order, please. Could I get a motion for approval of the agenda? Ms. Curran, Mr. Smithers, all those in favor? Aye. Opposed? Carried. Could I get a motion for approval of the minutes of the September 21 meeting? Mr. Smithers and Mr. Perkins, all those in favor?
Aye.
Opposed? Carried. Dr. McGuire and Dr. Williams, I would turn it over to you at this point.
Thanks very much. Dr. Williams, are you able to get my slides up? Okay, thank you. If you can advance. So for a case update, right now we have 260 cases, and that's through this morning. We currently don't have hospitalization. We have 17 active cases, and 339 have been through the isolation process. So we are still at 4 deaths since the response started. I always report the testing sites, and you'll see that we have a new testing site. It's at the Community Health Center of the North Country in Hampton. So there is the phone number. And just know that you do need to call and make an appointment. And that after you get tested, you should be self-isolating. Next slide, please. So this is the Epi Curve, and you can see that the dates are kind of getting smaller and smaller, and the lines are kind of getting thinner and thinner as we go on. I just want to point out here that we are just seeing like an increase. So if we go to the next slide, you'll see that the weekly cases that we're seeing, we're getting up pretty high. We haven't seen a week like this since the beginning of September. And during the past week, we have had 19 new cases. We have had 2 cases that I think will be just related to some clusters. We have had some of the gathering type of events with more than like 50 people, masks not being worn, social distancing not being done. So it's really important just to remember that we need to do that so we can keep the cases down. If you go to the next slide, it will just show the averages we see per day. And we have one more day in the week where I do the stats. And so we could be just seeing 3 cases per day, like with the addition. So we're just kind of watching that. Next slide. Here I just kind of show like how many new cases we see on the monthly basis. Next line, which is gold, just as we have more cases, that just counts it since we've started. We also do monitor just how many cases we see that do have the symptoms, and that is that gray bar. So we are just over the halfway mark for the month. So just many of the people do show the symptoms. Next slide, please. I've been showing the cases by age since we started, and it's that second age group that just really has started to rise. It used to be the 61 to the 70-year-olds, and now it's kind of replaced by that second group. Next slide. And here just shows the ages, or like the average of the age of the cases we see by month. Next slide. We have stayed pretty stable by sex, so it's just still slightly more half are the females. Next slide. And since the beginning, it's over now 4,700 people through the isolation and the quarantine process. We currently have 17 people who are actively being monitored because they tested positive. We have 251 in the active mandatory, and that is an increase of just over like 100 people in the last 2 days. And we have 132 people who are in the precautionary quarantine, and that is still due to the travel, the advisory. In the last few weeks, we have seen more people who have done the travel, who have come from states, and we do have 2 of the cases that it's possible that they may have tested positive because they have been to those states. Next slide, please. They always update the states, and so it's not until like in the morning that we'll see if there's some added. In the last 2 weeks, none have been taken off, and in the last 2 weeks, 6 have been added. So just important to note where you're going to be and that you may have to do the 14-day just when you come back. Next slide, please. These are taken from last week. I didn't have time just to grab the data, but last week on Wednesday, this showed the positivity rate for the last week. And I looked just before the meeting, we're currently at a 2.6. So we have just really, and I just want to point that out. So if you can go to the next slide. There are some of the counties that are really seeing a high increase. And so you may have been hearing about those hotspot kind of zip codes. And so many of them are in the New York City area, but there are some just around the state. And so with us now being at the 2.6 level, you know, we're kind of increasing too. So we need to be taking note of this. Next slide. And this is that hotspot. So there's red, orange, and the yellow zones. And it's when you start to see these zones that there will be like a type of like a restriction of what you can do. Next slide. So this slide here shows a brief summary of some of the things that will occur. And you can see that when you hit red and orange, schools need to close down for a 2-week period. And when you're just in the yellow zone, schools also test 1/5 of the population of that school in the zone per week. So with that said, if you go to the next slide, there was a press release out that they were going to be passing out testing kits. There was only like 400,000 kits. And so with 19 million people in the state, that's not enough kits to pass to all the counties. We did have to fill out a plan template and send in a letter by the end of last week. So I did do just a request of what we would need, particularly if we had to test school students and staff, and then those who become positive due to like an exposure, and then other high-risk people. So we will hear kind of whether we will get that. But because we are not in a hotspot zone, I don't think that like we'll be the like priority county, but they said that there will be some other opportunities. So, and then it would be important to note that if we got these test kits, where would we have the testing sites? Because you'd have to be like certified to do the labs, and you'd have to be able to report into the state system. And so those are kind of some of the barriers that we would have to work out. So when I send in the template, it's the plan really to use the current sites we have, because they don't currently have that kind of like the rapid testing right now. So that is something that we lack here just in the county. Next slide. We've been working with K-12 schools because in the last 2 weeks, new guidance did come out. It has been challenging to try to do the implementation. One of the things that has been more clear is that while it does provide a flow chart for the different audiences, so for the parents, for school staff and then for the administration to know who can attend school, who needs to leave, and what needs to occur. The screening questions that are asked now are more clear. But if there is a symptomatic person, whether it's a student or a staff member, they must leave school or they can't come to school. And they must see a healthcare provider, which then will determine whether they need a COVID-19 test or if they can have just a diagnosis outside of that. At the 48 mark, excuse me, at the 48-hour mark, we work with the schools on those families or staff members that have not yet been able to see their doctor, that haven't had a test, or that haven't had like the results of that test. And here in the county, we're not getting test results back in the 48 hours. So it is really important that we do have more access to the rapid testing. We also have a lot of the docs and healthcare providers that would like the students to get a test first. And so we're trying to educate them because it just doesn't, it doesn't follow the guidance. So for the student to be able to return to school, there's certain things that do need to be in place. So we are working hard on just trying to get more of the testing and then trying to get education out to the providers as well. Next slide. So with the Halloween coming up, we are trying to provide some of the practices. We know that are going to occur, and there are some that are kind of better than others. We're going to do the trick-or-treating. That is not the preferred kind of activity, but to be thinking about how you can change those things. So we did send guidance out to many of our partners, but if you have some questions about what can be done just to make it safer, please call the office. Next slide. And I do always end. These are still the recommendations. It seems like we're starting to get tired of the whole response, but it's really important that we keep all of these things in mind. So it's important to wear a mask when you're out just in the public and when you're with people who are not part of your kind of normal household. It's important to do this social distancing, and hygiene is still really important. And we are still seeing a lot of cases where people went to work, they went out to public, they went to school when they had symptoms. It's really important to just check yourself, know just how you feel, and to stay home if you don't feel well. And as we see cases, while they're still rising in our state, we're still doing a lot better than most places. So it's really important to stay home. And at this time, those are the slides that I have.
So thank you, Dana. I was going to go ahead and continue some of her thoughts and also talk a little bit about start by talking about the national trends that we're seeing. As far as new cases per day, what we saw in mid-September was there was a decrease to around 40,000 cases on a daily basis. But just recently, we've come back up to between 60 and 70,000 cases per day, which is a 30% increase over the past 7 to 14 days. So there's lots of concern about a new surge. As far as deaths per day, what we're seeing is that they're between 700 and 1,000 deaths per day. So it's decreased from the peak back in mid-April, but there's still a substantial number of people who are dying from the infection. As far as geographic distribution, it's now the upper Midwest, and the darker the color means the larger number of cases per 100,000. So what you're seeing is in the upper Midwest, they seem to be getting a fairly significant increase in cases. So the big picture nationally is that we have more than 8 million documented infections. We have just slightly more than 220,000 deaths. And there are 27 cases that are reporting an upward trend in their 27 states that are reporting an upward trend in their cases. So just in the past couple of weeks, there seems to be sort of a national uptick in cases. As far as regional data, if everyone remembers, we're in the North Country region, which is composed of 7 counties. What we saw back at the beginning was about 3.3 cases per 100,000 individuals. And more recently, we've kind of been on a bit of a seesaw, but right now we're at about 1.5 cases per 100,000. As far as hospitalizations, it's gone up and down. It's per 100,000, and it was 0.4. Now it's a little bit lower, but we are still seeing that when patients become ill, they do, at least on a regional level, end up being hospitalized. As far as testing, I wanted to just mention that there are 4 basic themes with testing. Number 1 is access. Number 2 is accuracy. The third thing is the speed of getting test results. And the fourth thing is cost. As Dana mentioned, there are testing centers, and the Community Health Center of the North Country in the Canton site is the newest addition as a testing site. There is also the St. Lawrence Health System has a COVID pediatric clinic where we're trying to provide access to rapid assessment and testing. And then there are also some independent providers in the community, as well as a private urgent care that does offer testing. As far as accuracy, the most accurate test still remains the RT-PCR, but that's also the slowest test. So that's a test that gets sent off to the reference lab, and the turnaround times are pretty consistently between 2 to 4 days. The least accurate kind of test are the rapid antigen tests. And then in between are the rapid molecular tests. So it's a little confusing. There's 2 kinds of rapid tests. One is slightly more accurate than the other. The biggest issue is just getting access to any of these tests. As far as speed, again, the majority of our testing still is sent to the reference lab. So the sample is collected locally, and then it's sent out to a reference lab, either LabCorp, Mayo Clinic, or University of Vermont. For the rapid molecular or antigen test, the biggest problem is just our limited inventory. And Dana mentioned that we did apply as a county to try and get some of the $400,000 or 400,000 tests that are being distributed. We're not optimistic that we're going to get a large number of tests, but we're hoping that we can get some to kind of augment our inventory. Some real challenges with, as Dana alluded to, the pre-K through 12 schools. I'm working with the providers in the community to make sure that everyone understands that the healthcare provider needs to evaluate the patient and document that they evaluated, and that the students can't return just based on a negative test. They have to be seen by a healthcare provider, and they have to be seen within 48 hours, which, as we know, can be a challenge, and the healthcare community is really trying to rise to the occasion. For alternative diagnosis, it has to be a known chronic condition that's not changed, or it has to be an acute condition where we can get a laboratory confirmation or some other concrete evidence that there's an alternative diagnosis. As we mentioned before, if a test takes more than 48 hours to come back, the student is considered a presumptive positive case, and that sort of starts some of the public health interventions. And again, a negative test in a healthcare provider evaluation is important, but that doesn't mean a student can automatically return to school. If the student has strep and hasn't started antibiotics, or if they have some other illness which is contagious, they may have a negative test and they may have been seen by their provider, but they may still be told that they need to stay out of school for the appropriate amount of time for whatever illness they're diagnosed with. I did want to shift and talk a little bit about what's happening to universities. And I was going to give sort of some national trends to put things in perspective. So nationally, there are more than 130,000 COVID-19 cases documented on college campuses. There are 35 colleges where there's more than 1,000 cases on the campus. And there's 230 colleges where there are more than 100 cases on their campuses. If you look at what's happened in St. Lawrence County, if you go to the bottom here, you can see that there have been 19,000, almost 20,000 tests have been performed on our college students. There have only been a total of 21 positives, and there are really only 7 active cases. So if you put that in the perspective of what's happening nationally, again, I think our colleges have done a really tremendous job. They've worked very hard to keep their campuses safe, which is very important for keeping our community safe. As I discussed before, they're also very interested in transparency. So these are the links to their websites where they actually have dashboards. So if anyone's interested, they can look and see the information for themselves. This slide is, I think, as Dana alluded to, does anyone have pandemic fatigue yet? So this is very exhausting for everyone. We started having these meetings back in March. I know Dana and I were hoping this would be, a 3-month challenge that we would rise to, and then we'd all go about our lives, and Dana would get back to regular public health, and everyone else in the community has the same feeling. So really, the most important question is, what's the long-term strategy? And I would argue that the consensus in the public health and the science community is that basically continued public health mitigation measures, so the 5 pillars that we've talked about, as well as the contact tracing and the testing programs, and also vaccine development and implementation. I do want to just address what's something of a controversy, which is this idea that's been put out there of establishing what's called herd immunity through natural infection, which is as opposed to through vaccination. And I'm just going to explain a little bit about what I mean. So if you look at this graphic, on the top is a situation where there's no herd immunity. And basically what happens is, if you have a transmitting case, so that's an infected individual, if nobody's immune, they transmit the disease to a susceptible person. And because nobody's immune, they transmit it to the next susceptible person. So that's basically, the infection has an opportunity to spread from person to person unchecked. In the case of herd immunity, the immune person basically acts as a shield and protects a susceptible person from an infected person. And so this is, when people talk about herd immunity, this is the idea. So basically, if there's enough people who are immune, it sort of stops the infection from being transmitted from person to person. So what's the problem? So the problem, and again, this is the problem with herd immunity without vaccination, is that we really don't know whether people truly become immune to this disease for a prolonged period of time. And there's ample evidence that immunity does decrease over time. And with many of the other coronaviruses, people become reinfected. So to have herd immunity, you need to have immunity. The second thing is, most people feel that you need around 70% of the population to become infected. And even in areas where COVID has hit very, very hard. So if you remember New York City back in April and May, where their ICUs were overflowing, there's a tremendous amount of death and suffering. They only got up to about 20%. So to get to 70%, you really need a significant increase in death. And also, as we talked about before, there's long COVID syndrome. So there's people who have COVID, don't die, but still suffer from the effects for a prolonged period of time. There's also some discussion of something called focused protection, which is the idea that you would identify an at-risk portion of the population, which some people estimate to be about 20 to 30% of people. So these are people who are of advanced age, obese, have hypertension, diabetes, and other risk factors, that you would sort of cordon them off and try and protect them. What's been shown in this country with nursing homes, and also frankly in Sweden, is that it's very hard to actually do focused protection. So vaccination is the key to herd immunity. So herd immunity is in a way a goal, but the goal should be achieved through vaccination. And these vaccinated individuals would be able to provide that protection for the rest of the community, but without risking their own health by having the natural version of the disease. The idea with public health is that these mitigation measures basically provide us time so that we can develop and implement a safe vaccine. So really, as far as I'm concerned, a public health strategy of herd immunity without vaccination, or public health mitigation efforts, really isn't a strategy at all. It's unwise, it's impractical, and unethical. So I just wanted to give you my perspective on that, which I would say is shared by the majority of the scientific community and medical community. So this begs the question, so where are the vaccines if this is so important? I want to point out that if you look at the history of vaccine development, many vaccines took somewhere between 11 and 28 years to develop. So we've really put ourselves on a very tight timeline. I think the goal people discuss is something like 18 months. Some people feel that the goal is even shorter. So if you put it in perspective, what we're asking in terms of vaccine development is really unprecedented. There has been a tremendous amount of financial support given by the federal government, as well as the international community to develop these vaccines. But it takes tremendous effort to get a vaccine out, and to do it in such a short period of time is a real challenge. If you look at what's happening, there are literally hundreds of vaccines that are in some stage of development. And people might hear about these terms, so preclinical, phase 1, phase 2. Any drug that gets FDA approval, or any vaccine that gets FDA approval, goes through a series of trials, basically, to determine, first of all, if they're effective, but more importantly, are they safe? And what you can see is that there are 142 in what's called preclinical. There's 35 in phase 1, there's 19 in phase 2, 11 in phase 3, and right now there are 0 that are actually FDA approved. I will mention that I believe there are 3 versions of a Russian vaccine that skipped phase 3, and there's like 3 versions of a Chinese vaccine that skipped phase 3. So if there's any volunteers to take the Russian or Chinese vaccines that haven't been through phase 3, then you can talk to me after the presentation. So there are, however, 3 vaccines that are kind of on the cusp of getting the safety data that we need. There's a company called Moderna, which is working with NIH. There's a company, Pfizer, which is the one that's likely to announce their readiness first. I do want to point out that one of the challenges with the Pfizer vaccine is that it has to be stored at negative 94 degrees Fahrenheit. And that's not a typographical error. That's actually negative 94 degrees Fahrenheit. And so there's sort of a national effort to identify places that actually have freezers that can maintain that kind of a temperature for a prolonged period. Right now in the county, there are very few, and we're trying to figure out how that would work out. So there's going to be logistical problems once these vaccines are available. And then finally, I should mention that AstraZeneca, which has worked with Oxford University, also has a promising vaccine. And these are the 3 that people anticipate are most likely to be available sometime in the future. So the bottom line is that there's been a significant increase in cases nationally, and unfortunately, as Dana just outlined, locally. And this is a concerning trend. St. Lawrence County and the healthcare partners in the community have really worked hard to increase access to rapid, accurate tests, because as you can see, especially with the school age students, that 48-hour deadline is a real challenge, and we desperately want to keep the kids in school and want to keep the teachers and everyone safe. Because of everyone's effort, the pre-K through 12 schools do remain open and safe, but there's ongoing challenges. The colleges continue to have their intensive safety measures in place and their testing plans, and we have positive results so far. And then second to last, I think we really have to continue to work in partnership with businesses, our restaurants, and our schools so that they can remain open and safe. And I think as a community, we need to continue to understand what the impact has been on our businesses. We need to acknowledge this, and we need to do what we can to address this. And finally, a long-term strategy still has to be public health measures while we're awaiting the development and introduction and implementation of a safe vaccine. So that's it for my thoughts.
Thank you, Dr. Williams and Dr. McGuire. Does anyone have any questions for either Dr. McGuire or Dr. Williams? Mr. Akers.
Thank you. Thank you both for your presentations. So Dr. Williams, the good news is that even with the cases going up by 30%, the death rate is staying flat, roughly 750 to 1,000 a day. It's still a loss, but at least it's not going up 30% also. Is that a result of better treatment, or is it actually the more testing and the ages of those that are actually getting the COVID? Are they in the age brackets where they're not as susceptible to the morbidity?
I think we're probably seeing at least three different factors. So one is the age and the lack of comorbid illness of the people who are being diagnosed is in our favor. I think the second thing is the medical community, I think, has figured out how to more effectively treat people when they do become ill. The third thing I would just caution people about is it's an odd virus in that the first part of the illness for most people can be pretty mild, but it's not until the second or third week where people become very ill. And for many people, the average day between diagnosis and the average time between diagnosis and death is something like 28 days. So what you see sometimes is you see a peak and you think, well, there's no increase in death. But then if you look, the second hump, so that the deaths come about a month later. So let's keep our fingers crossed that there's not a corresponding increase in deaths but I would argue we won't see that for another 2 or 3 or even 4 weeks.
What is the temperature of liquid nitrogen? Is that minus 273 Fahrenheit? For storage for that vaccine that you mentioned, the 94, specifically 94, it can't be 95 or 96 or 92?
Well, what I can tell you is that there's a large group of engineers and other people who are really trying to figure this out. Not so much the temperature of liquid nitrogen, but basically figuring out what they call the cold chain of storage. So, and the problem with vaccines for those of us who are in the vaccine, who administer vaccines, you have to make sure that if a vaccine is supposed to be stored at a certain temperature, that throughout its, after it's been produced, through its shipment, through its storage, until it gets administered to an individual, it has to maintain whatever the recommended temperature is. So Pfizer's trying to figure out how to ship it, working with like FedEx and everyone to use dry ice. I think initially the biggest problem is even at hospitals, pharmacies that do have these medical freezers that can monitor temperatures, the negative 94 is just a real challenge.
Yeah, I would imagine. Thank you.
Oh, excuse me, Ms. Terminelli.
Thank you, and thank you both, Dr. Williams and Dr. McGuire. What is the current wait right now to get a test? If somebody wanted to get tested, are they able to be tested in the county immediately, or is there a wait?
So the testing centers are set up by appointment, but for the majority of people, if you were to call, first thing tomorrow morning, you would be able to get an appointment to be tested that same day. I think the bigger challenge is if it's a reference lab test, even though you may have the collection done tomorrow, there is the wait, which is between 48 and 72 hours. That's a big challenge.
Right. And then non-COVID related, are there any plans to do a drive-through flu shot clinic this year, or for any of the other? I know the school immunizations have kind of passed. Those have been taken care of, I think, for the most part. But with the flu season coming upon us, any plans for a drive-through clinic?
So we did that for the county employees. We actually had to cancel last Friday due to the rain. And with the increases in the cases that we're seeing, we don't have enough staff to hold them at this time.
Okay, thank you.
Mr. Reagan?
Have we begun planning, once a vaccine does become available, and once there are shipments available to St. Lawrence County, do we have, have we begun planning how it will be distributed and gotten into the hands of healthcare providers, clinics, others?
We have started those discussions with the state. So the counties have been asking this question. So we're starting to get information from the state about what the distribution is going to be. And it's just starting. So I think we're hoping that the local health departments will help to be the primary contact so that we can get it out to the clinics. But we don't have all of the information yet at this time.
Mr. Arquette.
Thank you, Mr. Chairman. I appreciate your efforts in trying to get the rapid testing here to St. Lawrence County, because as I'm sure you're aware, we have many folks that are heading to Watertown to get that, which represents a problem in itself. Again, they're traveling when they wouldn't normally be traveling. So again, I appreciate your efforts in getting that a little closer to home. Thanks.
Thank you. Anyone else? Mr. Burke, did you have a?
Yes. Dr. Wams or Dana, somewhere, I think maybe it was on TV that they announced that there is a belief that with the flu vaccine that could help mediate some of the effects of COVID. Is there any truth to that? And if it is true, does that not give a renewed impetus for flu vaccine?
So I'm not sure that I am familiar with the article or the information specifically that you're discussing. What I would say, however, is that I think the biggest concern is that people would become ill with influenza because they didn't get vaccinated, and then would simultaneously have an infection with COVID, which could be deadly in combination. Where somebody might be able to survive influenza or they might be able to survive COVID, but if they had both at the same time, it would, number one, complicate treatment, because some of the treatments we're using for COVID are not necessarily helpful in influenza, and vice versa. So I think that what I'm seeing is more just an emphasis on influenza vaccination to prevent having that illness at the same time you might have COVID. And also, frankly, with influenza, that also can overwhelm hospitals if it's a really bad year. And so we want to make sure that that we keep bed space available.
So no preventative, to your knowledge, there's getting the flu vaccine does not necessarily mediate the intensity of COVID if you were to get that.
Not to my knowledge.
Okay, thank you.
But the bottom line is you should still get a flu vaccine.
Right.
Legislator Haggard.
Thank you, Mr. Chairman. A month or so ago, I asked about the pharmacies running out of flu vaccine. And I didn't know if either you, Dr. Williams, or Dr. McGuire knew anything about that. And if they are, is there any way that public health could get more or provide a clinic? And if you don't have the staff to do that, can something be done so that people who want a flu shot and can't get one through either their doctor, or I just went to Walgreens and got mine, but they ran out. Do you know anything about that?
I have heard that the pharmacies have a low stock in them. We put our flu shots for the orders in sometime in March. So for us to try to order flu vaccine right now is kind of challenging. It's probably the same for all who try to do ordering. Dr. Williams, I don't know if you have any comment on, what vaccine supply is for the clinic as well.
Yeah. So unfortunately, I think what's happened is there has been a greater demand for flu vaccine than last year. The manufacturers tend to, produce based on what happened the previous year, which of course now we have much different conditions. So what we're finding in the community health system and at the St. Lawrence Health System is that there's some problems with the supply chain for flu vaccine. There is sometimes a period where there's a shortage, but then they're able to produce more. So I think we'll have to see what happens over the next few weeks to months.
Any other questions for the Dr. McGuire or Dr. Williams? There being none, I guess I do have a question, and it's in regards to, well, there was just over the weekend, there was a football coach, college football coach, that had tested positive, I believe, 3 times for COVID. And then he was retested, again, 3 or 4 times, and was tested negative. So my question is how can, and assuming they're the same type of tests, how could you test positive 2 or 3 times or 4 times and then have a test again and test negative?
So I'm not familiar with the particular details, obviously, of the case. I would say 2 things. Well, 3 factors. One, there are different kinds of tests, as we've talked about. Some of them are more sensitive and able to detect disease than others. So it might depend on which type of test he took. The second factor is the collection. And so, we've probably at one time or other, we've all had our throat swab for strep throat. And you may remember the doctor or the nurse who got a really good sample, which is very uncomfortable. And then you may remember somebody who got not such a good sample and you didn't have strep throat that time, but maybe because they didn't really get to the peritonsillar pillars where they needed to be. So it can be a collection issue. And then the third thing that we've seen, which I'm not familiar with this case, but certainly over time, people who are positive should become negative. And I'm not sure if that applies to that particular case.
Okay, thank you. I was just, yeah, it just seems that to the layman, it would seem that the test would either be positive or false, which I think leads to some confusion.
Yeah, and I'd say testing for this disease has been a challenge. I think people don't realize that in medical diagnostic testing, it's not a perfect science, right? So for testing for anything, we've all heard of people who had a CAT scan that was normal, and then it turned out there was a problem. So it's really, this is welcome to my world. I don't have a single test. If we had a single test that was 100% accurate, you wouldn't need me to be a doctor. So you have to have clinical judgment. You have to interpret things in context. I think one of the biggest challenges with COVID is that we have people who are without symptoms, so they're asymptomatic, but they're perfectly capable of spreading the disease to hundreds of people. And potentially, if they work at a nursing home, they can show up to work, be a perfectly wonderful person, not have any symptoms. They can have the infection, they can have no symptoms, yet they can transmit this deadly virus. So to develop a test that can detect somebody who has no symptoms is a real challenge, because that takes away my ability as a clinician to say, oh, they've got symptoms that are characteristic of this disease or that disease. They have no symptoms, but they're either asymptomatic, or what we also find is people are pre-symptomatic. So people actually have the short period of time where they have no symptoms yet, but that's actually when they're most contagious. So these tests are good. They're not perfect. It's very hard as a clinician for me to tell whether someone has COVID or not. So we're very dependent on these tests. And much like other medical tests, sometimes they're not right, but much more often they are correct. And in general, the technology is good and getting better, and it's our best tool right now.
Thank you. At this point, if there are no more questions or comments, we'll move on. Thank you, Dr. Williams. Thank you, Dr. McGuire.
You're welcome.
Thank you for everything you're doing for us. Next up, Michael Cunningham. Mike, are you with? Yes, you are. Mike is going to provide us with a presentation and a discussion regarding Something we haven't talked about quite a while, remote net metering, energy performance, et cetera. Mike, I'll turn it over to you.
Okay, thank you very much. I'll share my screen here. Okay, did that, well, let me get the slideshow thing here. Okay, is the slideshow showing now on everybody's screen? Good. Electricity is a large expense for the county. And since, as Larry said, we haven't really discussed it much lately, I just wanted to take a few minutes tonight to update the board legislators on our strategy for its procurement and answer any questions you may have. In terms of electricity, our goals are to keep prices stable and within our budget, keep usage low through energy conservation measures, and to satisfy competitive bidding requirements. There are three components to our electricity costs. First, delivery costs that are paid to National Grid. These costs include the delivery of electricity from the grid to our facilities. Second, the actual electricity commodity. We purchase this through Constellation Energy. And third, the cost of remote net metering contract with Gravity Renewables. And I will go into this in a little more detail later in the presentation. As illustrated in this table, costs have been relatively stable in total over the last several years. Electricity prices can be very volatile depending on the overall demand. To keep this volatility at a minimum, we include a fixed rate component in our overall market basket of electricity purchases. Currently, we utilize the fixed rate pricing at the correctional facility. Since this represents approximately 1/3 of our usage, this is a significant hedge against price volatility. In 2017, we entered into a remote net metering contract with Gravity Renewables that gives us the benefits of approximately 1.4 million kilowatt hours per year of clean hydro power from the Otter Creek Hydroelectric Project in Glenfield, New York, down in Lewis County. National Grid issues to the county credits at market rates for all the power that is put into the power grid from the dam, and then we pay Gravity Renewables a fixed rate per kilowatt hour for this power. This arrangement helps stabilize our costs since our remote net metering credits increase as market prices increase. When the costs increase at our facilities, these costs are offset to a degree by an increased amount of credits. It is important to note that our overall ability to get remote net metering credits is limited by the size of our National Grid bills. For example, if our National Grid bills are $200,000, we cannot get credits for more than $200,000. And I bring this up because it's an important point if the county would be interested in doing any additional remote net metering projects, such as solar projects. We have some capacity to do a little bit more remote net metering, but we have to be careful that we don't get very close to our limits. From a budgetary point of view, keeping usage at the same or lower levels is as important as the price per kilowatt hour. Over the past 5 years, we have completed one large project and are working on several other projects that keeps us up to date with the most cost-effective energy technologies. In 2015, we completed a comprehensive energy performance contract that included lighting improvements and other energy performance measures throughout our facilities. In addition to saving energy, these measures took care of a multitude of equipment and infrastructure issues that were deferred when budgets were cut during the big recession. Total cost after energy conservation incentives was $2.4 million, and the energy savings were calculated to be around $166,000 a year. In 2019, the county was awarded a $250,000 Clean Energy Communities grant from NYSDOH. The work being done under this grant award is ongoing and gives us an opportunity to fill some of the gaps that were not cost effective to do previously under the energy performance contract. And to stretch these dollars further, Dale Grant, our superintendent of buildings grounds, is utilizing in-house labor to perform many of these upgrades. In 2019, the New York Power Authority contracted with Dow Electric to update lighting in the courthouse to LED panels and install occupancy sensors. This was done at no cost to the county and is expected to save a significant amount on our lighting costs at the courthouse. And I'd also add on that the quality of the lighting has been enhanced dramatically by going to the LED panels. The last goal I wanted to speak to was the competitive bidding of electricity. Since there are many options for purchasing the actual electricity commodity, it needs to be competitively bid. We currently utilize the Municipal Electric and Gas Alliance, or MEGA for short, to do this bidding on our behalf. Under this arrangement, Genesee County and MEGA bid out electricity and allowed for the bid award to be extended to other counties in the state. Currently, Constellation Energy is the provider under this contract. Okay, I know that was a real brief overview of it, but I'd be more than happy to answer any questions that people have. I'll turn the sharing off here. Here we go.
Does anyone have any questions that they'd like to ask Mike in regards to his presentation? Mr. Lightfoot.
Mike, what kind of revenue or reduction in cost do we receive from that project, that water project sell to us?
Right now, with the cost of electricity being so down where it is, we are not really receiving an awful lot of extra revenue for that project. I mean, the good news is that the actual cost of electricity is down. So it's definitely below projections, but we're still staying above water, so to speak, with the contract. And as demand in the country, increases and the commodity prices go back up, that will become more and more an important hedge to our electric bills.
But it hasn't become a cost to us.
Not yet, no. And if, there has been a few times this year, especially back early on in the pandemic where, they were very close. I think there might have been a little bit where it was a cost. Overall, we're still above water on it.
Thank you.
Mr. Akers.
Mike, the governor has decreed that by the year 2035, I think, is it 50% of our electricity has to come from renewable sources? And if so, have you seen any projections from MEGA or any other information that you received about what the cost of that electricity will be, whether it will be more expensive or less expensive? Have you seen any projections at all?
I have not seen any projections that. I have read, some of the executive orders and things like that, but I have not seen anything yet from MEGA. I will say that, 10 years ago, we looked into the increased cost of renewable energy, and there was significant, well, I wouldn't say significant, but there was definitely a markup on it. I will say that over the last few years, that markup has decreased a lot. And I believe, the governor's thought process is that if local governments and state government take a lead on promoting renewable energy, it will become more cost effective. I think, those things were kind of the methods, that, pricing of LED fixtures, that kind of stuff have come down to, once there becomes more and more businesses and people utilizing the concepts, the price comes down. But I have not seen any specific things on it.
Then nuclear energy is not part of that equation for the year 2035.
I'm sorry.
It's all wind and solar. Nuclear energy is not part of that proposition for 2035. It's all about wind and solar, correct?
I believe small hydro would be considered that.
Yes, yep. Okay. Thank you.
Any other questions or comments for Mike? Mike, I guess I do have one. We talk about projected savings from energy improvement projects. I'm assuming that we go back and quantify the amount of savings that was actually realized.
Well, I mean, yes, on the larger energy performance contract we did, we were required to actually do benchmarking during, savings during construction, and we also had our energy contractor, Wendell Energy, come in and do some very detailed benchmarking after the first year. And that's where I got the savings amounts that I quoted earlier in the presentation. We did find that since there was a savings in that first year, we did not pay for the benchmarking in out years, but there's definitely something we have to look at, though, is, what is our actual savings?
Okay, very good. Thank you. Looks like there are no more questions, Mike. Thank you very much.
Thank you very much.
Next on the agenda is Sheriff Big Wharf. Have a resolution adopting New York State local retirement legislation, Chapter 542, laws of 2015, to provide for the crediting of service performed by a deputy sheriff enrolled in Article 14B of the Retirement and Social Security laws. Ms. Curran. Mr. Forsythe. Go ahead, Sheriff.
So this resolution I'm bringing forward is makes our job a little easier at the sheriff's office. Currently, we have to do an annual report of any deputies that work over 50%, submit it to the retirement system. It's very time consuming. You have to do each individual officer one by one, cumbersome. What this resolution does is it falls under Chapter 542, Article 14B, where this is done automatically into the state retirement system. So it just takes the reporting out of our hands and it just gets done automatically. To do this, I need a resolution passed to go from annual report to automatic reporting. That's what this is about.
Questions for the sheriff in regards to this resolution? There being none, all those in favor? Aye. Opposed? Carried. Sheriff, could you give us a jail update, please?
I can. So this morning, our jail population was 120, which I could tell you, I'll give you some numbers here. We're really going against the state curve, I can tell you that. We have a quarterly report at the end of September. The state jail population was down 37%. Our county was only down 16%. And as of today, that 120, if you would look from last year's date, we only had 113. So we're actually plus in our percentage of inmates. So your next question would be why? And I can tell you that we've had an increase in parolees. We've got 32 parolees currently in our facility on parole violations. Of those 32, 22 of them have been charged with other charges, which means they do not go back to state facilities. Only 10 out of the 32 would option out if they deem them to violate the parole, would go back. The other 22 would not go back to under parole until their local charges are taken care of. Hence, the state would rather have us watch them, then watch them. We've had 6 probation violations that are currently in our facility. And as I talked, and I have talked several times about bail reform, if you remember me speaking about it in the springtime, is that there were going to be a boomerang effect. Well, that's come to fruition, where about 20 to 25% or cases that are in our facility now were from subjects that did not show up to court for their appearance tickets or other assignments. Hence, there were warrants issued for those individuals. They were brought back to the original courts, and they went directly to jail. So now you've got a boomerang effect of where there was some probably that wouldn't even gone to jail in the first place, but for them not showing up, the judges and magistrates have said, okay, you didn't show up, now you will go to jail. And I can tell you about approximately 20 to 25 inmates are in our facility due to that. So you're getting a real, everything's coming together. The problem here is the trend is really going upward. In the month of June, we went up 24 inmates. In the month of July, 32. In the month of August, 47. In the month of September, 40. And as of today in October, you've gone up plus 32. Now that's not a net because there are some being released, but the problem is it's probably a 3-to-1 ratio of people coming into the facility than going out. At this rate, within a month or 2, we will be shipping out inmates to other facilities. And obviously that's a cost to the county and taxpayers, where we haven't shipped out in a long time. But with this trend continuing, I estimate 1 to 2 months, we are going to be shipping out inmates to other facilities to house. So kind of a big problem, obviously. What I've done to rectify it, and there's some things I can do, but I am limited in what I can do. I've talked to the district attorney himself and his office to see, to try to fast track some things. And obviously the courts and the court system, sometimes getting the inmates through the system can be a year and a half, 2 years, believe it or not. I've talked to parole to try to get some movement on the parolees that they can take back to get back, but obviously the state is the state, and they'd rather have us watch them than them because it's obviously money to them. But I have talked to them. Probation, I talked to the director today, or was yesterday, about maybe looking at some subjects being released on ankle bracelets, monitoring electronically. But that's a limited capacity. So I'm trying to do everything I can to keep our population down. But with this trend, it really doesn't look good.
Thank you, Sheriff. Mr. Reagan.
Sheriff, am I understanding you correctly? In the past, we've seen where the state of New York has pushed onto the counties housing prisoners want to be in the state prisons and just sort of held them up in county jails in order to artificially reduce the populations in the state prisons, so they can then say, oh, we don't need so many prisons because look at all the empty cells. Is that what we're seeing again?
Not so much, because we really don't have that many prison ready yet, because with COVID, everything's kind of been put on hold. I do know in the past, years ago, that if they were sentenced, then the state, each day after they were sentenced, would have to pay the county money for holding them after they were sentenced. They kind of waived that several years ago, where they don't pay that anymore. And you just, when they call for them, which takes sometimes a week or 2, now a little more with COVID because of testing, and there's certain medical requirements we have to do before we ship them to state prisons. I don't think that really hasn't slowed up that much. It has a little because of COVID, but there's reason behind that. So that's really not our angst. For whatever reason, well, I shouldn't say for whatever reason. If you've been watching the news lately with the drug bust up in Messina with 7 individuals, and over Augsburg this weekend 4 individuals, we're against the curve here. We're probably one of the few counties in the state. Instead of our numbers negative, they're a positive. I don't know how you want to take that. It bodes well, maybe for us putting people in jail because they need to be there, or there's a big time meth problem and drug problem in St. Lawrence County that I think it's more the latter than the former. And we just have an issue here in this county with meth. And I've said this before, per capita, St. Lawrence County is #1 in meth arrests. And it comes to fruition now that you see it over the weekend. We have a problem in this county. And I've said it, I'm going to say it again. You just can't rest your way out of it. There needs to be treatment. There needs to be education. There needs to be enforcement. All three together, I think, is where we need to go. Whether they're emboldened because of the COVID is going on, that they're really out there and doing this more, I just don't know. I just see an increase in jail population, and at the rate it's going, I don't see it slowing down.
Thank you.
Thank you, Sheriff. Does anyone else have any questions? Legislator Haggard.
Thank you, Mr. Chairman. I have 2 questions, if that's okay.
Absolutely.
Thank you. First of all, Sheriff, you mentioned that probation couldn't put people on ankle monitors. Is that because they lack the equipment or people to, Mr. LePage is right here. Wouldn't it be cheaper to buy more things for probation than house inmates that can't be on electronic monitoring?
Yeah, and I'll let Tim talk about that more in depth, but I know there's certain classifications, only certain people qualify. He can explain that a little better. I don't want to misspeak for him, but I just know there's certain only people that classify, and he can explain all those details. I'm not saying he isn't he's trying to do his best. He does a great job, and he's working with me. I just, we're getting up to that number where, okay, now we got maybe look at some alternatives for our population. Not saying, and I don't want people to think that, well, the sheriff doesn't want anybody in jail. That's far from what I want. But we're getting to that point where with COVID and the way we have to adjust our classifications with our pods, when we bring people in, they go to a certain pod because of COVID. There's a funnel there, and we're having difficulty with our funnel in one of our pods where people come in at first to go. We're getting such a big influx. It's making it really hard to make sure that this COVID is staying out of the jail. And we've done everything possible, trust me, with my administration in the jail and some other people, public health, working to keep this out of the jail. Thankfully, it stayed out. If it goes in, it's going to be an issue. But we get a funnel from coming in from COVID, especially the last couple months. Now we've got some increased cases. So we're cognizant of that and trying to do everything possible to keep it out of that facility. But I'll let Tim speak a little bit more on the monitoring.
So it's definitely not a numbers issue. We have plenty of units that we can use. It's because this is a grant funded position. There's certain requirements that they have to qualify for. The probation violations are one of them. And as he said, there's only 6 violators in there now.
Okay.
And we have considered them for the program, depending on criminal history and what they did to violate to get in there, limits whether we're going to release them or not. So the rest of the program is set up for pretrial cases. And like Brooks said, the boomerang effect right now is what I've been talking about at vacancies and that kind of thing. Local courts have been shut down for the last 6 to 8 months, and they started opening back up in August, and that's when he said his numbers started to spike. And I think it's because a lot of our old paperwork was sitting there for the last few months. And again, like he said, with COVID, we weren't drug testing for a while. We started drug testing again. People went 2-3 months without being drug tested. So unfortunately, when we started drug testing, we had a ton of positive tests. So the courts did revoke the releases. A lot of them are being evaluated for chemical dependency. If the judge deems that they could be released for treatment, we can put them on monitoring then, as long as they're still pretrial cases. We can't put sentence cases on with this grant. It's got to be pretrial. So we are working with the courts, but I think we're kind of in a situation right now where the ones we have sent back to court, we're waiting for evaluations and that kind of stuff. So it's definitely not a numbers issue. We can get more monitors. It's more of the right people to put on.
Thank you very much. My second part of my question, I'm sorry. I noticed, Sheriff, that you have your forum coming up on Wednesday. People can attend by Zoom. Have you had a good response? Do you expect a good turnout? I mean, you probably don't know who's going to show up in person, but are people phoning in to attend by Zoom?
I haven't heard too many. The undersheriff is taking those in. I didn't get a chance to even speak about police reform with him today because I had so many other issues at the jail and everything else. So I just don't know how many have even asked. But yeah, I'm hoping the public does show up or submits something in an email or wants to Zoom in. I'd love to see participation. So we do have that meeting set up with our stakeholders. Yes.
And do you have, I noticed that the Potsdam Police Department had 16 people from the community on there. Are you looking for a specific number of citizens to be part of that, or?
The stakeholders group, we have 15 members right now. We had a stakeholders meeting last week, run by myself and Mr. Lightfoot. So we have 15 members on that committee. It spans from clergy to certain organizations, professors, school board members, business people, we want a swath of the community. So yeah, we've already had a meeting. We're having another one Wednesday, including the public and some input. So yeah, we're on pace with our police reform, and we had a very constructive meeting. Mr. Perkins is on there. So we're trying to get all facets of the public and the stakeholder group.
Thank you, Sheriff, and thank you, Mr. Chairman, for indulging me.
You're welcome. Mr. Burke.
Sheriff, you said we can't arrest our way out of the meth problem and that prevention and treatment were important components. I wonder, as you look around the state, the people that haven't had maybe the dramatic increase in incarceration that we've had, is there anybody that you could identify or benchmark with that maybe has some innovative strategies as it relates to prevention and treatment?
There's a sheriff down in Albany that actually their jail, and we're in a totally flip side of this, but he had a jail population go down immensely. He actually changed one of the wings of the jail into a facility for mental health and homeless and some drug overdose issues. Obviously, we don't have that remedy. We're actually flip side. We're filling up. So he kind of was an initiative, was innovative that he kind of created that system. It took some monies, obviously, but I mean, working with other departments in the county, we could try to make some changes, but it all comes down to finances, obviously, and money. And like I said, our jail is kind of booming instead of going the other way. So yeah, there's some things out there in the state, but it's going to come down to some other agencies, community services and things like that to ramp up what they're doing.
Second part of the question, if I could, Chairman.
Go ahead, John.
I guess that kind of, as we talk about the budget tonight, or as we look at it, I guess maybe a rhetorical question is, what is it that we can't afford not to do? I mean, everything costs money, but kicking the can down the road, what does it cost? What does the county cost for incarceration per day? It's pretty dear. And I guess I think our sheriff department, I mean, I think you do a great job. So I wouldn't want you to interpret it as any other way, but I guess I'm just wondering, what is it that we could do if you had resources that could help correct this problem.
Yeah, I understand what you're talking about. I mean, I could always use more resources as far as law enforcement purposes, for investigative purposes. My detective division does an awesome job. They're really busy with this issue in the county. And I can tell you about 70% of the people that are in jail, and maybe Tim will chime in on this, are probably drug related. I've said it before. Either they're they're drug sellers or users, or they're because they're out of money or need more drugs, they're committing more crimes. So it's a systematic type thing where it just keeps rolling over. You guys can debate, what needs to be done as far as other issues. I would just work with other agencies at some remedies here. But me having 124 employees and 3 offices, civil, jail, and road patrol, and that's quite a hefty task for all of our employees, and they do a great job. But I could work with other agencies and whatever they need my assistance with to help this issue in the county, because it's just not going away.
Thank you.
Legislator Kern.
Thank you, Chairman. So since the 7th of October, we have had 4 fentanyl-related overdoses on the, both in Messina, 1 in Messina, and then 3 on the edge of my district. And I've seen quite a lot of commentary on Facebook about it. There was a police department where the people got pretty vocal on there and said, like, listen, we have to do something about this. This is everywhere. They did put a notice on their department page that said, listen, there's a lot of fentanyl in the cocaine, and so be careful if you're going to use the cocaine, that you might just die from it. But I sometimes think when we say, gee, we cannot police our way out of it, I think that there has to be some thought of, if we can't police our way out of it, what is our way out of it? I noticed one of the comments on Facebook to the police, back to the police after that post was, are you going to do something about it, or are we going to do something about it? I think if we stop policing, if we stop chasing people that are doing this stuff, that sort of sentiment is going to be something that may grow. Because if you have 4 people that die in your community in the course of a week, sooner than later, people are going to be more upset about it. And they were all 4 young people. So we have to think about, while we want to be nice about policing, we also have to think about how many dead young individuals we're willing to put up with before we put some people in jail. Just a thought.
I just would react. I'm not in any way saying we shouldn't do law enforcement and arrest people for these activities. I like it more to.
I'm not suggesting groups that you are. It's more of a statewide mandate being given to you.
Right. Okay.
Okay. Anyone else have any questions or comments for the sheriff? Thank you, Sheriff.
Thank you.
Next on the agenda is probation. We have a resolution authorizing the chair to sign a contract with Carol L. Poole Marolf for cleaning services at the district offices of Probation, Department of Motor Vehicles, Emergency Services, and Community Services located in Messina Harrogate Commons Building. Mr. Forsythe, Mr. Sheridan. Go ahead, Tim.
This is an extension of a current contract we have with Carol. We've had a 2-year contract with her now. This is an extension for another 2 years. Her rate remains the same. It's $25 an hour for up to 10 hours maximum. Obviously, summertime she doesn't do as much cleaning. Wintertime she does more. So summertime she averages maybe 6 hours a week, and wintertime she does closer to 15. Does a great job, and a great price for the county, I believe.
Any comments or questions for Mr. Page? There being none, all those in favor? Opposed? Carried. And the next resolution is authorizing the chair to sign a contract with Julie L. Lawless, LCSW, for counseling services for the probation department. Ms. Curran and Mr. Perkins. Go ahead, Ken.
So again, this is another extension of a contract. Julie's been doing our assessments and our sex offender classes for the last few years. Her rates are staying the same. It's $25 for group, $35 for individual, and $250 for group. Nothing's changed. So I just ask that we extend this for another 2 years.
Questions or comments on this resolution? There being none, all those in favor?
Aye.
Opposed? Carried. Thank you, Tim.
Thanks.
Next up, planning. And we have a resolution authorizing the chair to sign a contract with New York State Department of Transportation for public transportation services. Mr. Akers and Mr. Sheridan. Go ahead, Jason.
Thank you. Good evening, all. Yes, this first resolution is just to sign a contract for some funds, $100,000 in funds that we've received as part of a 5311 operating account for our transit budget. And we do need a formal contract signed to request those funds, and that's what this resolution does.
Questions on this resolution? There being none, all those in favor?
Aye.
Opposed? Carried. The next one is a resolution authorizing chair to sign a contract with Volunteer Transportation Center Incorporated to provide mobility management services in St. Lawrence County. Mr. Akers and Ms. Curran. Go ahead, Jason.
Thank you. This is authorizing to sign a contract with VTC, Volunteer Transportation Center. They have been our provider for a number of years now. We did do a formal RFP process, and they were the sole responding agency. They've done a good job for us, and we do look to renew their contract, sign another contract for the next 2 years with VTC.
Questions for Jason on this resolution? There being none, all those in favor?
Aye.
Opposed? Carried. Thank you, Jason. And now, can you give us an update on the lead grant?
Sure. Yes, happy to. We've made continued to make some progress. It may be slow progress, but it is. We're going in the right direction. We still have the same number of completed projects at 3, but we have more projects in progress. 4 in progress right now. We have 3 additional applicants that have been income qualified. So that's the next step before letting contracts for the individual homes is the income qualification. And then we have a list of 8 individuals that have an interest and are starting to move, starting to move through the process. I mentioned last month that one of the challenges that we're facing is the high cost of rehabbing homes in St. Lawrence County. I mentioned the fact that we have older homes, we have larger homes here that are occupied by eligible applicants. So we have had some progress with that. We've had several conversations with the funder, with HUD, and we do have an agreement in principle that increase our expenditure from $20,000 to $30,000 for these bigger projects. And we also have an agreement with our state funder that we can use some of our funds from a a countywide housing rehab project to match those funds, match the lead fund. So that would allow us to put a package together of $60,000 if needed for homes. That's good news. I said an agreement in principle. We're still working out the details on that, but I'm hopeful that that will allow us to get over some of the hump on these bigger projects. Happy to
Good. Sounds
answer the questions.
good. It sounds like you're making some progress. Mr. Burke.
Jason, your department's been very successful in securing grants for the county and the county taxpayers. Are there any limitations, resource limitations, in applying for grants? Do you have enough human resources to do the work, or could we be securing more grants if you had additional resources?
Good question, Mr. Burke. I guess there's always a opportunity. There is funding out there that with with additional staff we could look to secure. But I guess the flip side of that is the more money that you secure, the more money you go after, say in the grant writing process, the more that money needs to be spent and administered. So it's really it's a two-phase approach. If you do receive more funds, that's great, more funds coming in, but that money has to be, or those grants have to be managed, and that is an additional challenge. So certainly resources would be beneficial, but just remembering that resources would I guess get more resources.
Thank you, Jason.
Thank you.
Anyone else have any questions or comments for Jason on the lead project? Okay, Jason, can we go on to the census update, please?
Yes, happy to do that, and I will share a screen if I can here quickly, just to give you some numbers. Okay, can everyone see the screen? It has some numbers with 3 yellow highlights.
Yes.
Okay, great, thank you. So as you're aware, the census did wrap up last week. The 15th of October was the last date to respond to the census in any format, either by calling in, by going online, or by filling out a paper copy on the 15th of October Hawaiian time. That's not Pacific, it's the one further west from Pacific. That was the last time, or last day and time, to submit a census form. So we do have some final numbers here that I'll look to just touch on briefly, that you see on the screen. Starting at the countrywide, we have a number that is actually better than we saw in 2010. And these numbers are for the actual response, the response that people filled out on their own. It's called the self-response rate. So in 2010, the country 6.5% response rate. In 2020, it was 66.7%. And this, I've seen also 66.9, so we'll call it 66.8 to split the difference. Moving on to the state, fared pretty close to where we were in 2010, 64.6 in 2010 for self-response rate. In 2020, 64.2. And then looking down at the county, not quite as good as we were in 2010, 62.3 in 2010, and 57.7. We do have a 57.7 this year for 2020 for the county. We have Great response up in Louisville. You can see at the top of the chart there, almost 3 points ahead of where they were 10 years ago, and the highest really of any of these numbers at 70.3. So hats off to Louisville. Canton, pretty good response rate. Messina, all these numbers are pretty good in the 60s, mid to high 60s. Then, unfortunately, as you get down here, I guess, or fortunately, where the population is less in the county, our response rates were less as well. So some are unfortunately did not move all that much down in some of the more rural towns of the county. Comparatively to other areas or counties approximate to St. Lawrence here, Clinton County was certainly the leader at 64.4, but we were ahead of Franklin, Jefferson, and Lewis at our 57.7. So I'll just, if there are any questions about this chart, I'm happy to answer them, or I'll stop sharing and just mention one more thing.
Any, so
Jason, you're talking percentages. The county, I either heard 50 something or 60 something, I'm not sure. I think it's in the 50s, 54%, or is that what you quoted?
57.7 was the final number.
57.7% of what?
That's a great question. 57.7% of households. So what the Census Bureau does is they have a number out there. They do a lot of background work in the 10 years leading up to a census to identify households. Presumably, households are where people are going to be the majority of the population is going to be staying. So that's what they identify in that number. Now, of course, there are certain individuals that are homeless and are sharing accommodation. So they do a specific task of identifying those homeless populations as well, and they work that into an overall number. And I'll talk about that in just a second. But does that answer your question?
Yes, it does, but if I could follow up to that, do they have any comparison on the number of households back in 2010 compared to the number now?
Yes, and those numbers.
And I'm sure they have that, but do we have that?
Yes, certainly. We can get you that number if you would like. We do have the household identified.
Well, I think it would be interesting to, know what we're comparing things to, and to know how things have changed, if so, in the last 10 years with respect to the number of households that we are using to base these figures on.
Certainly, yep. Certainly happy to get those numbers for you.
Thank you.
Mr. Forsyth.
Thank you, Jason. Now you got me thinking, seasonal households. There's a large amount of seasonal households throughout this county. Are they considered in the household count?
Yeah, good question. They are considered. They are, if you were to run into a census enumerator, they would want you to report a seasonal household or seasonal home, even if you didn't live there. You shouldn't be double counted. You don't want to be counted in your home, the number of individuals in a residence in a seasonal home and in a full-time home. But they do want to know the number of seasonal residences in the county. So yes, those numbers are factored in.
Okay, because up our way, there was one guy came back, I think, 4 different times to a seasonal, so I'm sure they counted him pretty well on those. Okay.
Yeah, and that's something that I'll mention quickly. That if you look at some census numbers, if you go to the Census Bureau, or if you see some of the information out there, the Census Bureau claims that we have reached a response rate of 99.9%, and that's nationwide. Every state in the nation, save one, the state of Louisiana, which is at 98.6. We have all reached a response rate of 99.9. Well, what does that mean? I mean, that's perfect, right? 99.9. Well, what they're talking about there is what they call a non-response follow-up. So they don't actually have data, census numbers, number of people in every residence, but they have accounted for every residence, is what they mean when they say we have a 99% response rate. So it's you do have to dig a little bit behind the numbers, because we would think, well, our work is done, we're at a 99% response rate. Well, yes, you've identified all places where there could be individuals, but you don't actually have 100% response of individuals. So there's a lot of math and a lot of different nuances that go into census tabulations, but the numbers that I shared earlier, I think, are a little more accurate in terms of, okay, what did we actually see from individuals in St. Lawrence County responding to the census, and that's at 57.7.
Mr. Lightfoot. Oh, excuse me. I gotta get Ms. Haggard first. Legislator Haggard?
I think Nicole had her hand up before I did. I'll pass.
No,
Okay.
You were first.
Okay, thank you. The students, I know they're counted. And how is that done? Do they individually have to report, or is it done through the universities?
It is done through the universities for individuals that were in residence. So back the census day is April 1st, and with COVID, the question was asked, well, were there students on campus on April 1st? And that was a real concern of ours. But through our complete count committee, we had all 4 universities represented, and we were very keenly watching to make sure that the students were reported, and we were assured by the university representatives that they were in constant contact with Census Bureau representatives, and yes, that the students were counted. Now, there is a body, certainly a student body that lives off campus, and they would sort of be folded into the rest of the general public. But the university did work with us and with the Census Bureau to try to get as many of those off-campus students counted as well.
Thank you very much.
You're welcome.
Legislator Lightfoot, I'm going to allow Legislator Terminelli to go first because she has not had an opportunity to speak. Legislator Terminelli?
Thank you. I appreciate that. Just so I can better understand this. So 57.7% of households reported. So in that 42.3% that didn't report, would those also be households that are vacant, for example? So property that's up for sale, foreclosure, would those be included in that 42.3 that didn't report then?
That's my understanding that they would be. I'm just going to check a fact sheet that I have here.
So I'm just thinking 57.7 doesn't sound like, that's not a great number, right?
It isn't.
So I'm hoping that there's a
Right.
reason that there's a large number or a large percentage
Right.
that wouldn't be counted because there's nobody in them.
Well, the 57% are the individuals that have responded self-response. So
Okay.
if you filled out your census form, you'd be counted in that. There are always individuals that didn't get a chance to do it, didn't have the ability to do it. So that's when the Census Bureau sends out their enumerators, and that's what they call the non-response follow-up. And so it includes, I can't find it here quickly, but I will certainly double check. I believe it does include all households, but they do a good job. The enumerators go out and the attempt, our understanding is that they will attempt to talk to neighbors to see, is that house across the street, is that occupied? We have it on our list, but we've been back 4 times and there's never seemed to be anybody there. Is there actually anybody there? So they do a good job of trying to get the actual numbers, but if it's on their list and it is vacant, then I would say that it is included in that 100%.
Okay,
Now,
and then kind of going along with that, is a household considered like one home, one roof? For example, I know in St. Lawrence County, we have many homes that have been converted to duplexes, for example. So does that one address count as one household, or would it count as the separate entities that are within it?
it's the separate entity. So yes, if there are 4 units, then all 4 units count as a household.
Okay, great. Thank you, Jason.
You're welcome.
Mr. Burke.
Jason, 3 or 4 weeks ago, when we met with one of the state leaders, they commented on how well St. Lawrence County had done. So the idea that we would focus on the self-response rate versus the overall response, including the enumerators, the enumerators work. At that time, we were in the high 80s. I believe she said we were 88%. I'm wondering, Jason, if you could comment on the overall count, not the 99, we know that one, but the overall count and how we compare with the rest of the North Country.
So the overall count for the county is the 57.7. My understanding from the conversation with the census representative was that there are certain higher response rates by census tract. So that reference to the 85.5%, that I believe was I won't know the census tract number, but one of the census tracts that makes up the town of Canton was the 85.5% response rate. So unfortunately, it wasn't a county as a whole. It was based on individual census tracts, and that map is available. I'm happy to share that with the board. It's called the Census Hard to Count map, and it actually breaks it down by, you can query by census tract, you can query by town boundary, you can query by state to get those more specific numbers.
Jason, do you have the cumulative rate, the self-response plus the enumerators work? Because it's much higher than the 57 or 50.
Right. I wish I did, Mr. Burke, and unfortunately, from our data set the data set that we have access to doesn't break it down at the county level. It does break it down again by census tract, but it only is at the state level for the non-response follow-up. So I know we've inquired about that. Why can't we get that data? And so we're still looking for a resource to see if we can get that data.
Mr. Lightfoot.
Jason, how were the Amish counted? How do we go about establishing the numbers of Amish in St. Lawrence County? By personal check? I mean, they don't have phones. They don't use computers.
Right. Yeah, good question. And that's where we did a pretty heavily targeted outreach to these harder to count populations. We try to get them to respond with the self-response. So you're right, they probably won't do it online, but some do have telephones and they could call the number to respond or have a paper copy. The enumerators were going out to census farms to get the census population counted. We were trying to get the word out as much as we could to them. Were they counted in their entirety? I can't answer that. But those hard to count populations present a challenge every 10 years.
If I may. 10 years ago, in 2010, that census was completed. And if my memory serves me correct, it was March of 2011 when we had preliminary figures. What can we expect from this year's census as far as any information at all being forthcoming?
Yes, there was a fact sheet that was put out that said that the Census Bureau is working as hard as it can to provide the information as directed by Congress, which means that there is supposed to be a preliminary count to the president by December 31st of 2020. So that they didn't say that they would meet that goal. They said they would try as hard as they could to meet that goal. So the intent is to have some raw numbers by the end of the year. What we're hearing is spring of 2021 for any numbers that we would see that might have a little bit more value, that may be a little more refined for St. Lawrence County. So probably a similar time frame, but I would say that it could be pushed back because of the just the delay in all the enumeration process.
Thank you, Jason.
You're welcome.
Does anyone else have any questions for Jason? Very good. Thank you, Jason.
Thank you very much. Have a good evening.
Next on the agenda, the Board of Elections. I see Jenny is here. They have a resolution authorizing the chair to sign a contract with Center for Tech and Civic Life for COVID-19 response grant and to modify the 2020 budget for the Board of Elections. Mr. Lightfoot and Mr. Perkins. Go ahead, Jenny.
Yes, this is a grant that was pointed out to us by Mr. Lightfoot and by the State Board of Elections. Many counties have already received these funds. You may use these funds for any accounts that have that are not covered in the 2020 budget, any expenses. We have definitely exceeded that in many areas. We decided to use this money in the areas where we are going over the most, which is our part-time staffing and our office supplies.
Okay. Questions for Jenny, or I see Tom was on there briefly.
I don't know if I'm still on or not.
Okay, I guess there are no questions. So all those in favor?
Aye.
Opposed? Carried. Thank you.
Thank you.
Next up, Tom.
Question. Yes, I was told that you wanted to brief a report tonight on the Board of Elections activities.
Yeah, that'd be great.
Basically, we're closing in on 10,000 absentee ballots that have been applied for and sent out. I've really got to say our staff has been amazing at how they have held up under the strain in this entire year. They have just rolled with the punches. They put in extra hours, and my hat goes off to all of them. When you get a chance to, if you get a chance to speak to any of them, please let them know how much you appreciate their efforts. Most people will never see the work they've done behind the scenes, and that's all the staff people on both sides of the aisle. They've just been tremendous assets to the county. Also, out of those absentees have gone out. Over 5,000 have come back in. We are obviously that number is changing every day. So the real unsung heroes in this whole election, I want to say, go to the county legislature, to my fellow departments and the department heads. We could not do this without your support, and you folks have been absolutely tremendous. Other counties have had their departments struggling to get through this, and they have been very apprehensive to offer help to those boards of elections. That has not been the problem in St. Lawrence County, and I cannot tell you how much it means to all of us to have this kind of support. And I mean that because the work that's going into this is Herculean. And Ruth has literally said, whatever you folks need, let us know. And you folks have backed that up with your votes and with your support. And you can't put a dollar value on that. And to cheapen that by not quantifying that would be unfair to you folks. Joe Lightfoot made us aware of a $50,000 grant that you just approved that will help lower the burden to some degree. You folks have supported us hiring additional temporary individuals, and in doing so, we've been able to handle this tidal wave of work that's coming to the office. I don't want to leave out folks like the sheriff's department, the printing folks, the building and grounds department, all those folks, purchasing, and I don't want to leave anybody out. Planning's been there to help. Everybody's been willing to step forward and give us a hand where necessary, and I just want to make sure that I extend the thanks to all of them because they have all allowed this to happen, and I want to say thank you to every one of you.
And if I could just add, just in comparison, in 2016, that's the last year that we sent out the highest number of absentees, and that was 3,567. And as of today at 4 o'clock, we had sent out 9,446. The most we'd ever received back was also in 2016, and that was 3,196. We've received back 5,888. Just today, we sent out 251 ballots. We received back 527. When we leave the office at the end of the day and all of this work is done, it's a great accomplishment by our entire staff.
Great, thanks, Jenny. Mr. Arquette.
Thank you, Mr. Chairman. I think I know the answer to this, and thank you both for your leadership through this process. But at first, before Jenny weighed in, I wanted to make sure that the 10,000 is on both sides of the aisleway.
Yes, it's 9,446 in total.
Gotcha. Thank you again very much for all that you're doing.
Any additional questions or discussion regarding this resolution? There being none, all those in favor?
Aye.
Opposed? Carried. Thank you, Tom. Thank you, Jenny.
Thank you for your support.
We'll move on to emergency services. Matt, it doesn't look like you're in your office.
No, I had something come up, so I had to leave the office real quick.
Okay. First resolution is modifying the 2020 budget for the Office of Emergency Services for fiscal year 19 PSAP grant. Mr. Lightfoot and Mr. Perkins. Go ahead, Matt.
What this is, guys, is we're moving 25,000 from fees and services to technical equipment. This grant expires at the end of this year, so by doing so, we'll use some of that money to put towards upgrading technical equipment we have in the office, and this should exhaust it by the end of the year.
Okay. Questions for Matt on this resolution? There being none, all those in favor?
Aye.
Opposed? Carried. The next one is a resolution modifying the 2020 budget for the Office of Emergency Services for fiscal year 19 SICG grant. Mr. Lightfoot and Ms. Curran. Go ahead, Matt.
What this one is, guys, is we're moving 150 from technical equipment to other fees and services. This is to help pay for the cost of our consultant of the 3 new towers that we're in the process of putting up.
Questions for Matt on this resolution? There being none, all those in favor?
Aye.
Opposed? Carried. And the next one is a resolution authorizing the chair to sign a 1-year extension with the New York State Division of Homeland Security and Emergency Services Office of Interoperable and Emergency Communications for fiscal year 18 statewide interoperable communications formula grant. Mr. Akers and Mr. Perkins. Go ahead, Matt.
Guys, this is an extension. Hopefully we won't end up having to use it, but just in case we'd like to have the extension there. This money is going towards the construction of the new towers. The date they should be done is the beginning of December, but by the time all the bills and stuff clear out, I reckon that this grant will be closed out, which expires the end of this year, by the beginning of next year, but hopefully by the end of this year.
Questions for Matt on this resolution? There being none, all those in favor?
Aye.
Opposed? Carried. And the last one, Matt, is just a quick discussion, if you will, on the dispatch center grant, and maybe touch on the towers as well.
All right, the grant it's a targeted grant that we've applied for. It was before I come in to the position. We were told last year we'd have results back on the grant. This is a $6 million one, which we haven't yet. We still haven't yet. As you know, with the state situation, it's kind of up in the air, and if we get it or how much. So, we're kind of all playing it by ear. That being said, we do have some PSEP money that we had set aside to help with the renovations inside our office. There are some of that money left over that we're looking at possibly buying some equipment and some furniture and holding it over till next year if we do get the grant, or otherwise some ways to make some renovations. That's all I have for the grants. Tower updates, Governor is 99% done. The only thing we're waiting on that is a tower inspection. Waddington is up there in the 70-80%. Everything's up, everything's in place. They're doing a little bit of civil work, fencing and stuff like that. And Hammond's been started, the foundation's in. They're just waiting for the foundation stuff to cure. The tower steel and the shelter will go up next week, hopefully the beginning of the week. Like I said, that should be completed, targeted for the beginning of December. Still hear me?
It looks like the boardroom lost connectivity somehow. There we go.
Okay. So you guys got the best part.
Okay, my question is, we caught, in the boardroom, we caught most of the audio part, but the legislators that are zooming in, did you catch any of the audio? You did?
Yeah, they didn't lose them.
Okay.
Yep.
All right, good. Okay, anyone have any questions for Matt in regards to the dispatch center or the tower installation? Very good. Thank you, Matt.
Thanks, guys. Have a good night.
County Administrator.
Next up is the vacancy review. Just a quick summary. This month we met October 6th. There were 14 positions reviewed. This evening you will hear from the sheriff and from probation on 2 of them. And then at the services committee meeting, you'll hear the remaining 12. So there aren't any, with one exception, the one-stop career center will be at finance. Out of those provided to you from the 2 committees tonight, there's a request to create 5 positions. 2 of those are temporary positions, whether they be overlaps or a stopgap measure between positions. 3 will be requested to be abolished. And so far since January, I know in August I provided you with the year update as I do for vacancies, but since January there's been 111 requests. Projecting that out, we should be seeing approximately 126 if numbers hold. That'll be a 5% reduction over the 5-year low of last year at 134. So that being said, the first up is the sheriff.
Thank you, Ruth. So I have a position at the jail. A correction officer has resigned recently. Looking to fill this spot to get back up to my minimum staffing of 56. I'm with him leaving, that'd be 55. So I'm looking to fill this position to get to the mandated minimum staffing of the correctional facility.
Questions for Brooks? Okay. Thank you, Brooks.
Thank you.
The other one on this committee is for probation. Tim?
Hi, this is a position, you guys graciously allowed me to fill my supervisor position last month. This is a backfill from that promotion. The senior probation officer position does our drug court, our domestic violence task force, violence court, rights pre-sentence investigations, policies, procedures, does all of our transfer. Probably our busiest senior position that we have. It is our one of our busiest positions we have in the department. So I would like to backfill this position.
Any questions?
Doesn't look like, looks like we're good. Thank you, Tim.
Thank you.
Okay, so that concludes vacancies for the Operations Committee. I'll continue on, Chairman, if I can.
Absolutely.
Next up is the overview for the 2021 tentative budget. A few items that you'll find on Google Drive this evening. I'll walk through them. You can certainly take any questions that you have. There are half of your departments that report to this committee, so there are 12. Department heads are sitting out there, so if you do have a question, please don't hesitate. We'll try and pull them in. Just maybe say the department you'd like to talk about first. I'll walk down through some general facts, and then we can go through any of the departments on this committee. And when we conclude that, we can move on then, I believe, to the committee reports immediately following the budget. So to begin with, the fast facts. As you know, there's a proposed reduction in the true value tax rate for 2021. We have an appropriation decrease of $3.5 million. We have a revenue decrease also reflected in part due to the appropriations of $4.3 million. And there's a levy increase of $1.3 million associated with 2021 tentative budget. This budget also recommends an additional use of the fund balance in the road machinery or the road fund for highway, but it reduces that by 52% going into 2021. In 2020, we recommended $1,063,000, and currently we're requesting $500,000 be used from the road fund. Keep in mind that there's some longer-term planning going on. Certainly with the COVID response this year, we did not proceed or ask the board to consider the outpost project for highway. That is still sitting out there that we would like to consider moving forward with the board in 2021. That also may look in part to be funded through fund balance. I do need to update a misreport that I provided to you at the tentative budget. I had an interest in providing to you at Mr. Akers' request the change in assessed valuation for 2021. And that number is 3.89%. So we used to get excited when it would reach 1%. There were 3 revaluations this year for a levy or a valuation change of $230.4 million. So that obviously impacts the true value tax rate when you take the overall change in the assessed valuation and you back into what the true value tax rate will be. Certainly, an increase of $75 million over 2019, when we figure that for the 2020 budget, is assisting in being able to reduce taxes, but also looking at a smaller tax cap or a true value tax to the levy limit also complicates the budget process this year. But overall, categorically speaking, we are up $2.5 million in personnel costs. As you'll recall, we negotiated several contracts this year that provided the opportunity for us to set those funds aside in contingency, and I'll talk about those both a little later as well as at finance. But we're looking at an increase associated with the settlement of those contracts, and those no longer sitting in contingency, but being pushed out into departments to pay salaries. There are also, in the personnel lines, a couple of grade changes that have been applied. The 2020 contract for CSEA implemented was $750,000, so we certainly are seeing a 2.75 increase over that for 2021. We also have settled indigent defenders, and most recently Council 82. So those will be implemented for the remainder of the year once those contracts are signed, but certainly have impacts on 2021. One contract remaining in negotiations, and I'll update you on that a little later. Also, we've seen an increase in benefits of $4.5 million countywide. That's a significant increase as we had anticipated, perhaps not expected, the type of number we're looking at. But for retirement, this year we're looking at a $500,000 increase from $5.9 million to $6.4. We're also looking at an increase in healthcare of 20.9 this year to 22.7 next year, a $1.8 million increase. Moving on then, looking at Social Security and those other items that are impacted in our benefits. We're looking at another $225,000 in Medicare reimbursements and another $365,000 in Social Security costs, all associated as you increase salaries, those percentages also increase. Next up is equipment in the category summary. We've reduced in equipment this year, which many of you see those month after month, year after year, modified by the receipt of grants or other modifications requesting funding through the duration of the year. So typically this ends up being probably the most varied area of the budget. We're down $509,000 for a 30% decrease over this year. Moving on to contractual items, a 6% decrease or $10 million this year. Looking at most of it, $9.9 million being in highway. As many of you are aware, this was probably the most significant year for highway in a couple of decades, in that our revenue went from 25 million, from 14 million up to 25 million, my apology, and we're going back down to a more traditional year next year. Also, we're looking at increases in revenue, or I'm sorry, a decrease in revenue of 4.3 million or 2% reduced over this year. Moving on next, we're working this year to address a lot of the withholds and the reductions that we're seeing, and asking the departments that we're aware of at this time to provide us with some updates on those reductions in 2020. 1.67 million in highway, 10.297 in social services, and just under 500,000 or 443,000 in community services. For a total at this point in 2020 of 11.8 million that's being withheld from the county. So overall, we had some goals this year. We look to remain under the New York State tax cap. We look to maintain the current level of services, both mandated and locally preferred. We're adapting to the COVID-19 response requirements while we continue serving the public. We're continuing to work to fund the reserves created in 2018 and 19, and certainly looking to hopefully in 2021 meet the fund balance policy goal of 1% of appropriations following the close of the year. My recommendations included, of the available tax cap, which is $1.4 million, using 1.3, leaving 132,000 essentially on the table if the board is interested in increasing that total. I'm appropriating the same amount to the fund balance policy that I did in 2020, or $1.536 million, which is 0.6%. So the goal is 1%. It's identical to 2020. I am recommending the 500,000 be applied from the highway road fund balance, and also recommending that rather than look at financing in 2021, that we appropriate from the road machinery fund balance approximately $2 million for the purchase of equipment. Those are the general high points. I certainly would take any questions, any department questions you have. As I mentioned previously, if you want to just mention the department first, that'll give the department head time to either activate their video or listen to the question that you have.
Mr. Light.
You mentioned that there is 11 million plus being withheld from the county. I assume by the state of New York, or is it a combination of the state?
Yes.
State?
Yes.
Can you break down, at least generally speaking, what departments are affected by that?
At this point, we have notification, official notification from 3. That's highway, social services, and community services. And I'm certain there are grants that are outstanding countywide.
And if I may, has there been any outreach by the state of New York of an attempt to claw back any unused funds, grant funds, or any other funds that we have been provided with this year as a part of their effort to balance their own budget.
There are many conversations going on, and I've requested as department heads hear from their state agencies or receive any notification officially that they let us know. But no, we have not seen that yet.
Okay, thank you.
Any other questions?
Mr. Akers.
So Ruth, in the recommendation of the tax cap and your first recommendation on the Google Drive, if we went along with that recommendation, what would the true value move from? Right now, your proposed budget is $8.19. Would it move?
With the remaining 132,000?
Right.
Yes, it would move to 821.
Thank you. So as it is, using the 1.3 million of the available 2020 tax cap, it remains at $8.19, correct?
That's correct.
Thank you. So I think it's important to point out that all the withholding of $11.8 million that's being withheld by New York State, that 10.3 million of that is the Department of Social Services. $1 million of it is highway. Thank you.
Anyone else, comments, questions of Ruth, or any of the departments? Mr. Forsythe.
Ruth, just a quick question. To establish 15% fund balance of our total appropriations, are you projecting 2021 we'll be able to do it?
I believe that's true. Should, depending on state reimbursement.
Okay.
Yes, that, I believe that's possible.
Okay, so once we get this budget, once we get this through, COVID's done, my goal for the year following would be to reduce property tax by 10%. Instead of appropriating 4 to 5 million each year, I think we owe it to the taxpayers to start really making true progress on the tax percentage. I know we did it back in 2007, I believe. It hurt a bit. I think it was 2006, 2007. And I'd like to see, that's just my idea, but get through this, but I think we can make some progress. So, is that feasible? $4 million from the budget?
We would have to look at that.
That'd be about $4 million.
We'd have to look at that.
Yeah.
Exactly.
I think it's about
Not far off.
Yeah.
So by my math, we have, and actually what you've stated is we have 21 million in unappropriate fund balance right now. And to reach the goal of what the comptroller recommends of 16.7%, we would need to move that up to about 29 million. So for the inappropriate fund balance, we would still need to increase 9 million. You anticipate that 9 million would be attained in a year like this for 2021. That would be a stretch, would it not?
The board's policy is not the comptroller's recommendation. The board's policy is 15%.
Okay.
So
So that would, let's take $1 million off that. I mean, I don't have the calculator in front of me to calculate that, but.
Well, we'd have to look at that. I didn't speak to any of the fund balance numbers tonight.
Okay.
But I can certainly take a look at that.
I didn't mean to get off on a tangent.
That's okay.
I just some.
That's okay. Mr. Chair, the only other two areas I was going to speak to, if there's no other questions.
Mr. Burke.
Oh, okay.
Go ahead, Mr. Burke.
Just a general comment. I would hope that we would take a long, hard look at what the needs for services are in the county and what it has actually cost us. Sheriff Bigworth touched upon it tonight a little bit. You can either pay now or you can pay later. We can continue to pay the cost for incarceration and ignore the root of the problem, which to a large extent is substance abuse. I would like to think that we have the ability to do some planning, some real assessment and planning, rather than the single focus of putting money back in the fund balance. It's to save a nickel today and cost $1 tomorrow and down the road makes absolutely no sense. And not to take a look at and really have a good assessment of what the community's needs are right now is, in my opinion, it's not responsible. And I would hope, instead of pulling arbitrary figures out of the air and saying this is what we should shoot for, I would like to think that we're capable of doing some assessment of need and what might actually save us money in the long run and enhance services. There needs to be some planning. And our failure to plan, I mean, we can continue to have the single focus of putting money away in the fund balance. And we put Ruth in a very awkward position. I mean, you know, her ability to function is limited by what we expect her to put in the fund balance, what we expect as far as the tax rate is concerned. So her ability to stand back and do any kind of long-term planning is limited by the restrictions this legislature places upon her. It's a no-win situation. We need to do some assessment. We need to do some planning, and we don't need to pull an arbitrary figure out of midair and say, this is what we're going to do. Our responsibilities as a county is to provide services. It's not to keep dropping nickels in the piggy bank.
Mr. Akers.
So the drug problem is not a problem of a fund balance problem here in St. Lawrence County. The drug problem is a worldwide problem. In the United States, about 80% of our inmates, the incarceration, are from nonviolent drug users. So we've got about 5% of the world population, but we have about 25% of the world's population as prisoners, as inmates. So this is an ongoing problem. Portugal, back in, I think in the year 2000, realized they had a really severe drug problem, and incarceration wasn't working for them. And they basically took all their resources for fighting the drug problem, as far as misdemeanors and arresting people, began focusing on treatment. And they're still trying and arrest the major drug dealers and that kind of thing. But it's a total change. And it's not something that St. Lawrence County is going to solve. As far as, it's not that we can't attempt, but it's not a financial issue. I get Mr. respectfully, I agree with Mr. Burke and some of his assessments, but whether St. Lawrence County throws millions of dollars at this or does not, will not solve this problem. It's a bigger problem than St. Lawrence County. So the fact is that we've gone from a position of a negative $3 million fund balance where we're borrowing up to $12 million a year to meet payroll. And we've gone to a position that is $21 million in unappropriate fund balance. Provides us security, and the comptroller recommends 16.7, which would basically give us about 2 months of operating this county. It's a solid system, it's a stable system, and we aren't even at that level yet. We're at 11.6%. And if you look at the towns around us, I think the average, Mr. Lightfoot, is it not 30 or 40%?
45%.
So it's 45% as far as our towns and villages that make up this municipality, as far as the proportion that they have in fund balance in relation to their relationship, excuse me, getting dry here, to their tax levy. So we are at 11.6. We are nowhere near this affluent surplus money situation that could be thrown around to solve this and that. I mean, if you recall, approximately a month or 2 months ago, the bridge that's out there between, that's across from the Norfolk School. The recommendation off the cuff was, let's take this thing down, $8 million, $2 million to take it down, put it back up for $8 million for people that are less than 200 people a day are crossing. And so those willy-nilly proposals are not in the face of what, when we have 200 bridges to assess about what is important and what needs to be done. 200 bridges and 600 miles where everybody runs across these, those seem to be the priority. And a stable fund balance helps us, particularly in a year, if we are in good shape for in a COVID year, we're expecting loss of sales tax revenue. And as you look, we just pointed out, $11.8 million is being held back by the state. How much of that will we get? So we can absorb this in some fashion. There's going to be pain.
Mr. Arquette.
Thank you, Mr. Chairman. I didn't hear Mr. Burke in any way talk about solving world problems. I think he's trying to solve problems here in St. Lawrence County, and he simply is proposing with having a life's career experience in substance abuse and, just that we may need to make an investment to save the county money down the road with mental health and substance abuse. I've been part of these budgets for over a decade now. I don't want to in any way engage in an argument that that we're talking about well beyond the 2021 budget that we're proposing right now. I think that we should keep that within a certain time frame. Great to look ahead, but along with Mr. Burke's suggestions in and around those areas, again, and you just spoke to it, Legislator Akers, we have bridges and roads in dire need. And, at some point, and again, it's great to have money for a rainy day, and it's great to follow the comptroller's advice, but we have a great need to invest some of this money back into infrastructure along with what Mr. Burke suggested. So I'd like to move into 2021, see how things go, and, we'll make these kind of arguments down the road. Thanks.
Arquette. Mr. Burke, you had your hand. Yes, go ahead. John.
Yeah, well, and again, Kevin, I certainly didn't mean to draw a curtain over the work that's been done as far as saving money, because it's been important, and it's good that we're in the financial shape we are today. My concern is that let's listen to our department heads. You don't have to listen to me. Let's listen to our department heads and ask them the questions that, if you had sufficient resources, would it enhance services and would it save money? And I again, it's not, I'm not looking to spend down the fund balance on anything that's not important or anything that doesn't provide a good return, either in the form of services or money to our taxpayers. I'm just saying that I think we need to change the paradigm a little bit and shift it from the sole focus of putting money away and restoring the fund balance, and then to take a look at what we might do that would actually enhance services and enhance revenue down the road. Again, not trying to diminish the work that's been done, just trying to encourage people to let's keep our ears open and see what our department heads recommend.
Anyone else have a comment? I can't, you got to put your hands up. I can't see them when they're down here. Ms. Curran.
So, I think it was Marcus Aurelius, the emperor of Rome, that was credited with the saying, poverty is the mother of crime. I think that when we tax people too much, I think it's the taxpayer that works that chooses to pack a U-Haul and move to Tennessee and other states with lower tax rates. Left behind are the people who are poor and cannot just pack a U-Haul and leave. I agree, John, that we have to think about how we're gonna help people and get rid of some of this drugs. I think drugs and the concentration of it in our county is a strong motivator for people to decide to take their families someplace else that appears safer than what we have going on currently. But I think that there has to be a mix between giving some tax relief to people that work and getting some more community-oriented people together on a volunteer basis that are willing to do some of these community policing efforts that I'm seeing in Waddington and Louisville. And we've even got people in Waddington now rescuing cats and make sure that they're gone and, you know, getting fixed so there's not future generations of cats wandering around. But I think we're gonna have to get our heads together and try to figure out how we get volunteers to do some of this, because unless we get a volunteer effort and feeling in the community that we really wanna work on this as a group of people, just assigning a couple more people in a department isn't gonna get us out of the situation that we're in. That's kind of what happened to the Roman Empire.
Mr. Fett.
I just think that maybe we can look at this once in a while a little different way too. I think we've got to go back and go to maybe what all of us have said a little bit on priority-based budgeting. So basically, when we go back and we got to look at various things, when we look at budgets in the future, where we're talking about if we don't assess this necessityness or discretionary spending money we spend. Start from there and say, are we spending non-necessary or discretionary money? And start with the priorities first. Go down instead of just looking at every department and saying, boom, here's how much money you had last year. Here's what we had. Are we giving you some money that's discretionary? What do I mean by that? Do we really need to spend?
Anyone else have any comments? Mr. Reagan.
One of the ways of helping to address a lot of these social problems is to increase the economy and help grow our businesses and grow our economy. I'm curious, is there money set aside in this budget for the fishing tournaments that have propelled St. Lawrence County as to get them designated as the top bass fishing destination in North America, which basically means the top bass fishing destination in the world? Is there money set aside for that?
Larry, can I answer that? There is not. There are two areas that the board has accessed for those funds. One is the high water money that flows in from NYPA that is not recognized as revenue until it's needed. That's been done for the last 2 years. And prior to that, the untargeted contingency was also accessed for that. If there's an interest in budgeting for that, certainly guidance can be provided and that can be done.
Because I think it's important that we get that money set aside for a fishing tournament this summer. I think that one of the, this past year, there was a great deal of indecision and questions about whether or not there was going to be a tournament. I think that if we do feel that we want to have another tournament, if we do want to keep St. Lawrence County as the number one destination for bass fishermen in the world, we need to set that money aside so that the organizers can begin their planning. We've been fighting a battle of defense for the past several months because of the COVID. I think a lot of the business community has suffered tremendously because of the COVID, and I think that we need to start planning ahead to get our economy moving and give our business community some hope that there will be efforts made to bring tourists to St. Lawrence County, remind people that we have one of the greatest freshwater fisheries in the world at our doorstep. We here in St. Lawrence County tend to forget that most of the rest of the world doesn't know about the St. Lawrence River or what we have to offer. And the efforts of this board over the past several years succeeded in making us a recognized destination. And I think it's important budgetarily that we set that aside as a priority so that planning can begin and there isn't going to be this last minute scramble in which the organizers do not know whether or not there will be any funding for them. And every year there seems to be a squabble about it. I would think, let the squabble happen now. Let's not tarnish any tournament that we do hold in the weeks leading up to it and create that indecision and that worry that we've seen in the past.
Legislator Hager.
Thank you, Mr. Chairman. I'd like to piggyback on what Mr. Reagan just said. There are a couple of entities that I'm familiar with that have been supported by the board. One I'm sure has, and one that I don't know if they have in the past, but could certainly use it, that have so much enrichment to our community as a whole and include ancillary spending in our communities, all our communities. I'm not talking about just my area. And that would be the St. Lawrence County Arts Council and also the North Country Children's Museum, both of which are wonderful groups that provide, maybe some of us don't fish. I don't, I'm sorry. But I know we're always trying to do things for kids in the arts, and we're blessed in this area with probably more artistic people than any rural county would normally have. And those are the kind of things that can, just like the Bassmasters, bring money into the community, but also provides enrichment, particularly for children. And those would be things that I'd love to see us use money, not huge investments, but what they need to bring people in. And I know, for example, the North Country Children's Museum had a study done by some business students at Clarkson University, and they brought in excess of $700,000 in spending in the communities, just from people coming to see the museum. And they're trying to expand and are part of our grant that we've received in Potsdam, and those would be things that the county could back up, because that doesn't serve just the Potsdam community. It serves kids all over. So thank you very much. I appreciate what Mr. Reagan said.
I've got two.
Oh, go ahead. I've already spoken.
Okay, Mr. Burke,
I've already spoken.
Well, go ahead. Go ahead, John.
Oh, well, I guess I just wanted to say what both Jim and Margaret are saying is let's take a look at cost benefit. Let's do some planning, and maybe we'll come up with some good ideas. Anyways, and I think the cost benefit should certainly include our county staff. Thank you.
Thanks, John. Mr. Akers.
Thank you, Ruth. Back when we were really squeezed, how many partner agencies? Right now we have Soil and Water, we have the Chamber, we have the IDA and Cooperative Extension. And I think it was in the year 2012 that we we left out, like say, what's the drama production, Ogdensburg communities, all those. I mean, we had like 40 some entities that we were actually.
21 entities,
21.
And we're down to 6. And the Arts Council was one of them, as Margaret was remembering. That is one that was formerly funded.
So I think it comes down to, I mean, those are all worthwhile entities, but I think what it comes down to is what are the priorities of the county? What's our actual thing? And it's provide services. And primarily those services, I believe, and anybody else I'm sure has another opinion, are about roads and bridges and public safety. The public safety includes social services and the things that we're doing there. Those really are the main functions. Everybody uses the roads and bridges. Businesses can't operate unless we have those. We know that we have a 40% efficiency rate. And I think that it's up to the individual communities to do what they're doing, whether it's Ogdensburg or Potsdam with their Children's Museum. I have not been there. I hear it's great. But I think it's up to them that the functions of what we do here, should be priorities, much like Mr. Fay said, whether he agrees with me or not. But I think it's roads and bridges and public safety. And I think those are the things that we need to provide for our citizens. We're asking the public to come up with 50 million, even though that assessment has gone up the 200 and some million, what did you say, $230 million. So a large part is talking about the poverty and the jobs availability, the ability to have functioning two-parent homes and households and raising our children and supporting our schools. It's not an easy answer. And I'll just go right back, and I've said it 3 times here now, roads and bridges and public safety. That's what I think that we should function.
Okay, Watson. Legislator Haggard.
I don't think they're mutually exclusive. I agree with Mr. Akers there. I said it. Okay.
It's catchy. It's awful catchy.
We're also write it down. Save the tape.
Nothing bites the dust.
We're looking. I'm just coming at this from the mindset of enhancing quality of life, adding to the attraction. This is not just something that is here and we enjoy. People coming to live in our community. Wouldn't it be nice if we got people to move to St. Lawrence County because of the great stuff we have here, like the beautiful river, the safety, the nice roads, great places to take your kids. So it's all one thing. I don't think they're mutually exclusive. Thank you.
Mr. Forsythe.
The reason I started the 10% wasn't to start a conversation. It's because when people have non-discretionary money, when they're not devoting their money to pay their taxes and buy their insurance and buy everything else, they spend their money. I'd rather, my thought is we build our fund balance up, give the people, the taxpayers a break, non-discretionary money, they can go to the museum, they can buy a boat, go fishing, they can buy insurance, they can do whatever they want with it, but it's not devoted to go to government. Government has to run efficiently, as reasonably as possible, and non-discretionary money.
Legislator Curran.
Just quickly, I like the idea of the Children's Museum, but at $8 per visitor per day, Margaret, I think it is somewhat out of reach for what some people have for a budget right now. So I didn't know if during COVID they were gonna have maybe a discount or some free passes for people who are living in poverty.
Okay. Legislator Haggard, then we're going to get on, with this process.
I just want, since Ms. Curran addressed me, I do want to say that they give away passes to people who are in need, and they do not make you come up with a financial statement in order to provide that. So there is a program for people who can't afford it, but I appreciate you bringing that up. They do take that into consideration. Thank you, Rita.
Okay. We have, where we originally started was the 2021 budget review for the different departments. With the ones that are listed here, A through M, is there anyone that has any questions that they would like to ask to a specific department?
I would just offer the position changes relative to these departments. As you may have seen in the documentation, an overall FTE increase this year of 2.12 FTEs, so just over. The 0.12, for those of you who may not be too familiar with FTEs, is typically a number of hours. So we try to make that into a full-time equivalent. And in this area, you may recall the beginning of this year, we created one full FTE in each of the departments, the District Attorney's Office, Emergency Services, and in the Sheriff's Office, to address the anticipated challenges with bail reform. It's been a very difficult year to identify if that has made a difference with the courts closing and a number of other challenges based upon the response to COVID-19. So those positions at this time have remained in the budget. I believe that over the next 12 months, we'll have a better opportunity to evaluate the value or the added benefit of having one additional person in each of those departments to address the needs. And we'll bring that back to you for the budget for 2022. Also in these department budgets, hours have been increased in the Board of Elections and a decrease in hours in Human Resources. Typically, those are the less than full-time positions. And then also hours just barely over 0.3 of a position in the Sheriff's Office have been increased. So those are the areas, very modest, but no decreases. So I did want to point that out, and then I'll review those for the services agenda at that time. I can review it now, or I can certainly review it at another time. I do have the contingency update, which is typically some would consider discretionary, but also a place where we hold some risk depending on how the year performs, as well as the planning aspect of capital reserve, which is an area that the board supported over the last 3 years, which has allowed us to maintain and take care of some of our facility repairs and maintenance in a formalized way. So I can do that now, or I can do that at the next meeting.
Let's do it at the next meeting.
All right. Then I believe you're on to committee reports. I think
Okay,
John
well,
might have a question.
Mr. Burke.
Chairman, you said that if anybody has a question, I would like to make a request of planning, and that they do a cost benefit analysis. And again, I don't know how the rest of you think, but if we have a department that brings in huge amounts of grants, whether or not we capitalize on that, I guess is up to us. But I'd like to think that if there is the capacity to bring more money in the form of grants into St. Lawrence County, that we maximize that potential. So I guess maybe that would be the question for planning. How would we maximize our potential for securing grants? And if it's too costly, then we don't do it. But if it's not too costly, maybe it would provide some net benefit. So again, I just like to have that, and not to put Jason on the spot certainly tonight, but I think for a future point in time, I think it would be a good discussion.
John, this is an area that Jason and I have been having some ongoing discussions already. We're talking not only about the opportunities through a grant manager type position, which we've seen tremendous success with, but also on that administration piece Jason mentioned earlier tonight, and on the reimbursement side of things. So as we see all of these grants and opportunities turning into a competitive situation, we receive the award, well then what? And I think part of what we've talked about is strengthening our ability to both track, administer, and capture the funds associated with all of those grants, and the reporting side. I think that you'll find across the county, we've developed some interest in it. Heidi certainly gets the information out, but Jason and I can have some more conversations and bring that to you. I think we have some interest and some ideas about that.
Thank you.
I almost hate to ask, but does anyone have any other any questions or comments? There being none, I just want to make an observation. And it's one of the things that's I've listened to everyone as much as I could, and I've been making notes. And one of the things that I've always thought it to be true, but I think I really discovered it this evening, that none of us are that much different. We all want what's right for St. Lawrence County. And I've heard Legislator Haggard talk about resources, the arts, making St. Lawrence County a great place to live. Mr. Fay talked about identifying priorities. Mr. Burks talked about planning. Mr. Akers has talked about fund balance. Legislator Forsyth has talked about giving money back to taxpayers. And it all comes down to, in my mind, that we're essentially the only reason that government is here is to provide services to our residents and our taxpayers. And I think we've got a lot of good ideas, and I think the key, we've got a lot of good ideas. I think we've got the necessary resources in this room and outside the room at different levels of the county to make everything happen. I think it's critical. I know it's critical that we have a fund balance. We've got to have a good fund balance. We know we were in the situation we were paying someone else $800,000 a year in interest, and I believe this year or last year we received $800,000 for people borrowing our money rather than us borrowing their money, which is a good place to be. It's a place we should be. So we need to have money, but we also need to take care of our infrastructure. We need to. So again, it comes back to identifying priorities. I think what Mr. Reagan says with the bass tournament. Sure, that's something that's key. We get good publicity. There's people all over the country, arguably the world, who talk about St. Lawrence County now. So I think all of this, everything that we want, somehow or other, we try to get it together in one single ball and figure out how to make it happen. I said it's become very clear just this evening that everyone's on the same page. We just have different different ways of how we want to get there. So that's all I have to say. On to committee reports. The very first one is Ag and Farmland Protection Board. And I've got notes here somewhere. We met Thursday evening, October 1st, via Zoom. And I guess the biggest point of discussion was the St. Lawrence County resolution that we passed encouraging landowners to lease marginal land for solar arrays. You know, hopefully that's happening, but I guess the thing is how to get some teeth into it. I'm not real sure that we have the ability to do that. And our next meeting is Thursday, December 3rd. Next up is Alternatives to Incarceration Board, Mr. Burke.
We have not met for many months now, and there is nothing to report.
Okay, thank you. Emergency Medical Services Advisory Board, Legislator Kern.
So we met and we talked about the COVID-19 situation, how it's affecting even air medical. When COVID first started, not very many people were taking air medical. They didn't want to go to the hospital, let alone be transferred to a bigger city. That's starting to come back, but they've been financially affected and looking for some federal aid to keep their doors open and their helicopters coming and going and planes. The biggest thing that we talked about is the lack of volunteerism that there is in both emergency services, medical, paramedic, EMS, and fire. So we were then kind of hit again this week when Canton College decided to cancel their paramedic program. They're going to finish out the program that they have, but they're not going to be starting another one. And Matt Denner and I talked, he and some other people from Emergency Services Committee are sort of looking to see where might we do that other than that. So this whole talk kind of led me sort of into your neighborhood, and I ended up going to the fire chief's meeting because the other thing we talked about was the new fire rehab policy. So now when people go in interior to fight fire or there's a really stressful scene, we have a little rehab crew that checks blood pressures and assesses people and sort of will be there to say, like, you don't look like you need to go back in, or, you know, your pressure's high or whatever. And it's kind of led to a conversation about know your numbers, know your blood pressure, know your cholesterol, know your own personal health, because if you aren't healthy enough to do this job, you're not helping anybody. It's gonna take 3 people to get you out of that building if you go down in it. So to that, I guess, and being part of the example that I want other people to be, which is to volunteer and help these things out. I am now a member of the Louisville Fire Department. And I will be going to different things. I have a pager app on my phone now, and I will be going and helping doing some of these rehabs outside of fires. If there's, you know, large, at least you'll have a medical person there. And maybe even some discussions and classes about personal health and management and whatever. There were some fire chiefs in that district that were interested in maybe having me come and present and help people with a little bit of personal health promotion.
Good. Good. Environmental Management Council. Legislator Terminal.
I reported about the last meeting that we had, and our next meeting is actually on Wednesday. So I will have an update at the next meeting.
Okay.
Thank you.
Thank you. Fire Advisory Board met Thursday, August 15th via Zoom. And I neglected to say earlier that the Ag and Farmland Protection Board was via Zoom as well. Reported that the resolution to include officers and members of the County Fire Training Center under workers' comp. Folks were pleased with that. Matt reviewed the tower project in Governor Overham and Waddington. Year-to-date phone calls handled at dispatch center, 9,510. And Our next meeting is Thursday, December 17th, and the rehab discussion came up there as well. And it's how actually, again, it's like the Ag and Farmland Protection Board. And we can pass, we can make policy or procedures, but it's difficult to make sure that they're followed by all the departments. Inter-County Legislative Committee, Ms. Kern.
My first meeting is going to be via Zoom this week because the county that we were supposed to go to doesn't want people coming from other counties because they don't have any COVID. So once I have it via Zoom, I'll let you know kind of what it's set up like.
Okay, thank you. Jury Board, Legislative Sheridan.
Mr. Chairman, the jury board has not met recently.
Okay. And Planning Board, Legislator Fay.
I thought Jason did a good job expressing basically what had happened with the planning board. But one thing I think he missed up on a grant, that there's still money, is in our septic tank repairs. There's still some money there. I don't know if Jason's there to tell us how much, but outside of that, that gives you an idea of how important grants are. And thank Jason for carrying my report.
Okay. Is there any old business to come before the committee? Is there any new business to come before the committee? Legislator Smithers.
I'm curious to know if anybody else was interested by the proposal of Assemblyman Walsey in the October 9th Watertown Daily Times regarding restructuring New York State Senate, which I thought was very interesting and worthy of our consideration of supporting this based on government of the United States in Washington, where the Senate has members based on the states. Each state has 2 senators. His proposal was in New York to have 1 state senator from each county, which would give northern New York a lot more representation rather than being overpowered by New York City, which currently is. So, and part of his rationale was that people are leaving New York because they feel like they don't have a representation in government in Albany because it's influenced too much by the metropolitan area where there's population. So rather than basing the Senate and the Assembly both on population, he'd like to propose changing it to the format where there's a senator from each county, which I thought was a good idea. So I was gonna bring it tonight, but it's worthy of reading over and thinking about it.
Okay.
Well, think about supporting that.
Yeah, you can get it to us, I'm sure it would be, yeah. Any other new business? Legislator Kern.
Hi. So, we have talked a lot about roads and bridges. I don't know, is Don Chambers still on with us, or did he kind of like peace out? Waiting to see if he pops up.
He'll be with us next week.
I'm
Anyways,
sure he's probably not here because it's the Finance Committee.
my idea was getting a sort of an estimate from him on how many miles of road and the estimated cost, and then the bridges and an estimate like of what it might cost, and put together some sort of a resolution asking for 1% of the gas tax from our county to be given to us for the purpose of roads and bridges. It's been talked about before, but if we took 1% of what we collect in gas tax, like 1 percentage point, and it came our way, I think that our roads and bridges would be more feasible. I know there was discussion over the weekend about people thinking that they could just kind of fix the roads and the bridges with what we had for fund balance, but I don't think it's a representative number.
Okay, well, that would be a good question for Mr. Chambers, and
Yes.
is that something you can prep him on? Good. No new business? Meeting is adjourned.
I just want to thank all of the department heads that joined us for budget tonight.
Yes, thank you, yes.
Out there, non-video girl.
Hi, Billy. Sorry I was late. How are you? I just come from the doctor. He said I'm good. Good. That was the physical one. The mental one, I kind of worried about it. How are you? Good. Good. I had a doctor's appointment. Last month. What did you see? Good BP? Let's see. Maybe just shut up. I'd like to come. I want to come every week. Just very nice to see you. I'm gonna go take care. I will see you.
But meanwhile, these people are dying and they're writing on Facebook about how you're gonna police this or we're gonna police this. Yeah. All the way down through. Might be worse than something like that.
Everybody here?
Yeah, it cost us a half an hour, we'll never get back.
Is that
what, hello?
Like to call the October meeting to order. Could I have a motion to approve the October agenda? Mr. Fay, Mr. Forsyth, all in favor?
Aye.
Opposed? Carried. Need a motion to approve the September 21st minutes.
So,
Ms. Kern and Mr. Lightfoot, seconds. Any discussion? All in favor?
Aye.
Opposed? Carried. Dana McGuire, I believe you're on the agenda first. We have a resolution authorizing the chair to sign a contract with Monroe County for morgue and laboratory services. Do I have a motion? Rita Kern. Second by Mr. Denisha. Go ahead, Dana.
Thank you. This is the first of the two resolutions that I have. This is an annual contract for the Monroe County. Last year, we added 2 contracts for morgue services due to when Dr. Livingstone is out and cannot provide service. So this is the first of 2. This is one in Rochester.
Okay. Any discussion? Questions? All in favor?
Aye.
Opposed? Carried. Second resolution, also for Dana, authorizing the chair to sign a contract with Our Lady of Lourdes Hospital and Twin Tier Pathology for morgue and laboratory services. Do I have a motion? Oh, I'll get my glasses. Mr. Burke, is it? Hang on. I got the short distance for here reading and the long distance for the screen. Yeah, I think Tony Arquette made the motion. Second, Mr. Perkins. Go ahead, Dana.
Okay. So this is the second contract. This is for morgue services down in the Bloomington area. Since we put these 2 contracts into place, we have had to use them both 2 times since the beginning of the year. With that said, Dr. Livingstone will be out at the end of this month, so it may come in that we will have to use these services.
Any discussion? No questions? Yes, go ahead, Dave Forsyth.
Dana, did we talk, and I know the board is closed, but did we talk about Canada before too, or no?
Did we talk about Canada?
Yeah, do they have any, or is it legal things with that, or what?
Yeah, so I don't believe in the past we talked about Canada. We did talk about going to the state of Vermont, and that is not possible. So we can't cross state lines. So with that said, I'm not sure that we could do Canada either.
I'm sure. Okay, no problem.
More questions? Mr. Burke, do you have your hand up?
Well, I have a general question for Dana, not specific. I guess I'm just wondering, Dana, with the recent surge in COVID, how is your department holding up?
We're holding up. This weekend, we were, there's about half of the department working. We do have the assistance of 2 other departments. So, so far so good, but if we continue to surge, it's going to be challenging.
Thank you.
More questions? All in favor?
Aye.
Opposed? Carried. We have another resolution for Cynthia, modifying the 2020 budget for social services for software, equipment, and office supplies for the Home Energy Assistance Program HEAP. And do we have a motion? Ms. Perkins seconds it. Seconded by Mr. Forsythe as well. Go ahead, Cynthia.
Good evening, everyone. So the resolution that we bring tonight is in regards to our HEAP funds. It's our HEAP funds from October, that runs through October 2019 through September 2020. So the deal was that we had to spend all of our leftover funding by the end of September 2020. So that sum came to the $81,424. So we chose to update our HEAP area, basically, with new office supplies, new office furniture. We also looked into some telephone system software that we have chose to go through technology that's going to provide us the opportunity to not only help the workers receive all the calls that come in, but hopefully it will leave less of our community members, hanging on the line or being cut off the line or being sent, as you guys know, all throughout the county when our phone lines get overrun during that time. So we're appropriating those funds just back into the account so that we can spend, that it's actually been spent on the HEAP program.
Are there any questions or discussion? Rita Kern, go ahead.
I just wanted to say thank you, Ms. Ackerman, for whatever it is that you're doing this year. I've had no phone calls about HEAP application problems.
I thank you. I will pass that on to the staff. I'm sure they will be pleased to hear that.
Mr. Akers?
Could you tell me, $48,000 seems like a lot to be spending on furniture. This is totally necessary?
Well, if anybody's been through the building here, you would see that a lot of the furniture that they have is extremely old, breaking. The dividers that we've had throughout the department have been here for as long as some people can remember. So with it being HEAP funding, we're hoping that we can replace, everything there, start there. And then, if there's anything that can be saved from that area that can maybe be used someplace else to replace something that's broken, that's definitely the plan that we're going to take. The building definitely needs an upgrade, and I think it will help staff morale as well.
Okay. It's unfortunate, the last meeting, we just talked about priorities, so that's why you're getting the wrath of it right now, so.
Yeah,
that's
okay.
Thank you.
It's okay.
Jim Reagan, did you have a question?
No.
Okay. Any other questions, Cynthia? Okay. All in favor?
Aye.
Opposed? Carried. Another resolution authorizing the chair to approve issuing a request for proposal RFP for an electronic health record and community services. I think Jay, you're going to address this. Do we have a motion? Did I skip one?
Yes.
Excuse me.
Cindy has another one.
Oh, okay. I did skip one before I got to the furniture. Authorizing the chair to sign a contract with Our Lady of Lourdes Hospital in Twin Tier. No, that's Dana. Hang on. I'm got a little
It's on the front
confused.
page, Bill. Just as a discussion item on your left side. Yeah, letter B.
Okay, all right, but I've got it over here too.
No
Hang on,
documentation.
I'll bring it with it, see. Oh, yes, okay, we're in discussion.
Yeah.
That is going to be on the DSS legal recommendation for positions. Sorry about that. That was just in the resolutions. Is there any discussion, Cynthia, on that matter that you have to talk to us about?
We have been discussing, I think I had brought the attention to the need for a potential additional attorney for Department of Services legal unit. I spent a lot of time researching, reaching out to different agencies, talking to a lot of other commissioners, and with that, I kind of ended up finding that our department is more of an outlier, I think, than almost any other department in this state at this time. You know, if you look at some of my statistics, back in September of 2015, we had 162 children in care. In 2018, we went up to 222, 2019, 287. And as of September 2020, we now stood at 322 children in care. With that, our legal department has changed very little, if at all. I've gone through the gamut of, looking at different structures from different, other counties, but there's really nothing that I can even take our unit and compare it to, because we have so many children in care based on, what our legal department is handling at this time. So with that, I had also taken a look at, whether we would contract out our currently pending 24 appeals, or would it be better to have that attorney in-house, where once the appeals are completed or at least caught up, that attorney could, in the meantime, help basically our drowning attorneys at this time. So it was thought to bring them in-house. So I was asking for a fill on a new position for a social services attorney. It would be a net cost to the county at $17,987. Another thing to look at too is in 2018, the legal unit here prepared approximately 3,400 child welfare documents. In 2019, the legal department prepared approximately 4,133, and that continues to go up. We talk about, trying to put some of our resources ahead of the game. I think if we could put some of our resources into this unit, it would allow our attorneys more time to prepare for the cases. And on the front end, putting that preparation into these cases will hopefully slow these cases down into coming back over and over and over again. I feel like we're kind of working on the fly, and that's no way to treat our families in this community, just trying to keep up. The other thing that we had talked about is we do have a student with us who is an intern student from Syracuse University. He did take the month of October off to take his bar exam. So he's hoping in January to hear the results of that. So he is returning. He's been working basically for free. He's doing an outstanding job, loves St. Lawrence Department of Social Services, understands the dynamics that go on in this department, and yet continues to want to drive from Oswego and home 3 hours to work here. He'll be returning back to work for free while he continues on his internship. So we were looking at some type of temporary position that we could put a person like this young man in, as he helps our attorneys, again, prepare for cases, which is one of the biggest needs that we have right now, is taking that time to, provide a quality service, instead of just trying to run on the fly and keep up with the demand. So we haven't really exactly figured out the name for this position fitting in here, but it would be a temporary position until this person would then, get the results of their bar and either, come in to work into our department here in social services, or perhaps take an open position that would be within the county at that time, allowing the county again to take, a student that has definitely shown his worth here in St. Lawrence County. So that position would be similar to some type of paralegal, but it would be temporary, and that would be a net cost to the county at about $13,700.
Mr. Burke.
Thank you, Cindy, for doing all that work. I guess the question I have is, could you tell us the connection between child safety and family outcomes with having efficiencies in the legal system? And last but maybe not least, is the cost, the county cost for the number of increases that we've had from the, I think you said 160 some to 320 some, or yeah. So I wonder if you could maybe help us understand the implications.
Well, I can give you an example. Like just as of today, we had 4 trials set for today that came in just last week to prepare for, and we had 22 support cases on the docket for today. When you talk about health and safety of our children, it basically starts at the beginning. If you look at, we've already had 160 calls into social services this month. We had 16 calls on Friday. So we have the caseworkers not only working their current caseloads, but also taking on those additional calls, because every call has to be investigated or at least looked into by one of our caseworkers. So then when it comes to, working with the legal department, who is already working on, all of these other items on their dockets for the day, there's no time for these two departments to connect, to discuss and talk about each child that's on the docket. I think having more time for that prep, just is going to create a more quality outcome. I feel like we don't have the time to research and review and look into all the cases, and unfortunately, I think with our new legal system right now, we don't have a lot of the historical knowledge on these families, and that's what the caseworkers have. So we need to bring that knowledge over to the legal department so that they can help present that information in a way that's best for that child. So if you look at the approximate cost of kids in care, the cost of just children in care in 2017, it was $10 million. That's our actual number. In 2018, it was $11,395,000. In 2019, it was up to $14.5 million. So in 2020, for the revised budget, we have we're still looking at the $14 million. So I think when you look at that, and you look at, we have a great team of staff here. We have dedicated staff that work with their heart and souls, and put a lot of time into these children. Offering that extra time to work together, which unfortunately is going to require a couple more staff so we can spread things out a little bit, is really, like, again, what I keep saying, is going to give us that quality outcome. Time to look at, a better placement for these kids instead of just popping them into any opening that might be there, because we only have 24 hours to make that decision. Right now, I'm working on 2 children. I've been working with the team upstairs. I'm working on 2 children. Each of these children are a cost of $30,000 a month to this department. These children have been in this care for up to 3 years. There hasn't been, I think, the time to sit down, look at these cases, look at where these kids are, reach out to the programs that they're in, finding out if they're the appropriate placements. Is there a least restrictive environment that would better, that would not only support these kids to bring them closer to their families, but offer a better outcome for them to be. The goal is to be in a least restrictive environment. The goal is for them to have some type of permanency. You can't have a permanency when you're going, for 3 years in one program, hopefully back into another program, and then maybe you'll be in a foster care home, or maybe you'll be with your family. Like, these kids need a sense of permanency, and we're supposed to be doing that within the first year or soon thereafter. you know, these two kids are on a list I have of at least 13. There's some of our most expensive children and some of our children that are, you know, spend most of their time away from their families just because, you know, they're either institutional care or they're at a super high needs intensive program. So I think that if we can get a few more people on our team to get some of these things done, that we can take more time to really look at these cases and see actually where these kids are and what we're spending our $14 million on.
Cindy, could I just ask, is there a way to break out approximate county cost of that 14 million, or is that too hard to do?
We can do it. Colin and I actually talked about that. There's a lot of different costs built in, so it would take time. Because I was hopeful that maybe it was like a 51% or a 47% across the board, but that's not the case because it depends on where the child is, what type of level of intensive behavior they're getting, or services that they're getting for their intensive behaviors, out state, in state. There's all kinds of different factors. But I'm sure we could, do maybe a kind of a 6-month look back maybe or something, just to give everybody some type of idea, because I would like to know for myself too.
I guess I'm just wondering, Cindy, cost benefit, what you're requesting is probably $40,000 or $50,000 county cost for additional staff. Do you think it would be safe to say that of the 14 million, that maybe the county share is upwards of $1 million?
Oh, absolutely. I would say, or more, absolutely.
Legislator Kern.
Thank you. So my understanding is that the caseworkers in this department have cases that are assigned to them. Each case represents a complaint. Like, if I might have a moment to explain it, if I call CPS on Tony, that case goes to Nicole. If Rick calls CPS on Tony, that case goes to Margaret. If the next person calls, that case goes to another worker. So it's not a system where everybody that's worried about Tony is all assigned to one person, so everyone knows what's going on. That might behoove us to move to that system. It's done in some counties. But I agree that it would be very difficult for legal to get a good sense of what's going on with all these people without some sort of case management meeting, which I think does require more time. I think once you get everything sort of collated, for lack of a better term, and get everybody's information to one caseworker and then on to the attorneys, you might be able to clear this a little bit faster than the way that it was done before. I think that you probably do need that help. My only question with that, prefacing it with that, would be, can the judges take another attorney? Can they process what another attorney does, or are we stuck on the judge end too? I guess I'm looking for your opinion.
Okay. I would say that some of it, I think a lot of the concerns we can control internal, but there's always going to be some of them that we cannot control. And that would be, when it comes down to what the judge says, that's what the judge says. I think you have to take in consideration too, like when I show you that we have 21, support cases one day, 22 support cases the next day, 16 cases on the docket, all of those, have an outcome of an order. And all those orders, then I saw, I went upstairs on legal, they had a pile, this high of orders that had come out of court. In regards to the caseloads, we are looking at, it depends on the call, the actual complaint coming in, but we do try to put the cases together unless it's something that, may be a conflict. And we are looking at, and we have been trying to have case review meetings. We're at least doing them once a week for a couple hours, but it doesn't necessarily always involve legal just because they're so busy in the court. But we're trying to look at some of the top cases and look and see, you know, where is this person placed? How long have they been there? Is there a better alternative or option that would A, you know, benefit the person, and B, be at a lower cost to the county, to the department?
Tony Arquette.
Thank you, Mr. Chairman. It's difficult for me to put a price tag on, you know, the lives of children as we talk through this, but we're also challenged with fiscal responsibility, as Cindy just explained to us. My cost, county cost, if I heard Cindy correctly, was closer to 30,000 than Mr. Burke's 50,000. Maybe I'm wrong on that, but whether it's 30 or 50, in and around the comparison with nearly $1 million of county cost, if we don't make a move like this, absolutely seems ludicrous. So, you know, I certainly support the moving forward and bringing these two folks into social services at a very fair cost, but most importantly, to protect our children.
Mr. Akers.
It's pretty simple math. I mean, Cindy, you said you had 24 appeals, and the cost of an attorney, our county cost would be roughly around 18,000. Certainly, you're not going to get an appeal done for less than $1,000. And the fact that we've gone from 215 children in care to 322, I think we need to move in that direction of adding additional staff.
Mr. Forsythe.
And Cindy, I'd like to congratulate you for looking at this. We also ran into an issue earlier in the year, or late last year, with the child welfare examiners. I think, how many did we add?
You mean caseworkers?
Caseworkers.
The caseworkers.
Yep.
We've added 4 or 5 to the mix, I believe.
4 caseworker assistants.
The other thing that sticks out, as long as we're looking at it and going back to 2015, the TAMP and the SNAP were considerably higher back 15 as opposed to 2020. Is there a way we can allocate resources from those two towards this? You know, they've decreased steadily, and I don't know about staffing levels. I'm sure they're probably the same. I don't recall hearing the staffing levels change, but maybe there's something we can utilize from there. You know, I don't know. I don't know how it works, so just thought.
Any response?
Yeah. I would have to talk to Colin, and we'd have to research to see what, I'm not sure what overlap, you know, certain programs have their caps on and what other programs we can reallocate to. But I reached out, and Colin would say about the $14 million would be about 60 to 65% reimbursed of what it's costing for our kids in care, approximately, if you average everything through.
Mr. Burke.
Mute, John.
No, he didn't have anything. He was just waiting.
Okay.
I wasn't sure if I answered everything. I might not have.
Who's got the question? Who?
Rating.
Mr. Reagan, go ahead.
Commissioner, I just want to thank you for focusing on these high-cost cases, and I know you guys have also been looking at some of the children who've been in the system for unacceptably long periods of time. I think that it's so important for us to address these children who've been left hanging for sometimes years, and you know, getting them into a stable situation. So if there are resources you need that will help the department address this problem, I think you'll find this board is willing to assist you in order to reduce the number of children in the system and reduce the long-term cost to the county, especially when we've seen it climb by $5 million. That investment that you're asking is not a lot, and I think the board supports your efforts as the new commissioner to address some of these long-term problems. Thank you.
Thank you, and I am trying to kind of slowly, increase and then look again and do like an assess as much as I can. So I'm trying not to, because what I don't want to do is throw a big Band-Aid on the problem. That's not going to make a difference. So I'm trying to, slowly bring on somebody else, kind of reassess, reach out some more, see what we're doing, and then, advance upon that. So in all my discussions, this kind of seems like a package that, I think will work.
Any further discussions or questions? Thank you, Cynthia. Now we'll go to the resolution.
One more.
Go ahead, Tony. Go ahead.
I apologize. Just for a point of information, were you looking for us to move on that this evening?
It's only for discussion purposes tonight, as far as I'm understanding.
Thanks,
Mr.
Mr.
Chair.
Chairman. A resolution is always in order.
I could answer that, Tony. Cindy was interested in bringing that forward since the vacancy discussion and the recommendation happened at this level to also make that request. So our intent, if the board doesn't object, would be to move that to the vacancy resolution that would come for November consideration.
Thank you, Ruth.
Thank you.
We got everyone? Thank you. Now we'll go on to resolutions.
Thank you, Cindy.
Thank you. You're welcome.
Next resolution is giving authorization or authorizing the chair to approve issuing a request for proposal RFP for an electronic health record and communication or in community services. And do we have a motion? Mr. Forsyth, Mr. Akers seconds. Go ahead, Jay.
Thank you and good evening. So as many of you know, we've been kind of struggling with our current electronic health record for quite a few years. It's certainly come to a lot of people's attention that the department would probably, be more efficient if we had a more updated, streamlined electronic health record that was, fully integrated between the billing and the client electronic clinical record. So we started getting, more serious, about looking at possible replacements at the beginning of this year. We had two software companies come to community services. I believe it was in January. Did a demonstration, of their software platform, and even more fully realized that the community services could benefit from an upgrade. Just kind of, I would say anecdotally with these two platforms that came, one had a startup cost for the first year of $179,000. Then there was a lower yearly cost of, that was in January, so prices may have gone up, a yearly cost of approximately $32,000. The other platform had a startup cost of $31,000, but their yearly fee was about $70,000. So just two different types of configurations, but currently we're paying $82,000 to IMA. And they're also talking of a 5% increase. So once the startup costs are out of the way, the one EHR would have a cost savings to the county compared to our current EHR of $55,000 a year. And the other one that had a lower startup but a higher annual cost would be approximately $12,000 to $16,000 in savings. As the things have gotten certainly more complicated with the healthcare system, and even more so with behavioral health. So, you know, we really feel it's time to, you know, to try to do an upgrade. The problem always was trying to pay for it. And because of the events that surrounded the RFP with the opioid treatment program, there was SOAR monies that were slated to help with that startup. But as you know, that did not go as planned. So those SOAR monies became readily available. And additionally, they have a no-cost extension for 1 year. So we have monies available through SOAR to implement the transition to a new electronic health record. And we have until September, the end of September of 2021 to do that.
Any discussion? Yes, go ahead. Mr. Burke, go ahead.
Hi, Jay. Just wanted to ask, the electronic health record also does billing, is that correct?
Yes.
Yeah.
Yes.
And the RFP, I guess I'm always concerned about an RFP only because, you know, the current vendor we have could come in at the low price, and maybe you could tell us how we would avoid a pitfall where we're doing it based on price and not quality. If you could address that, I'd appreciate it.
Well, I mean, I don't think price is the only consideration. I think, you know, there's lots of things that we are looking for in this new platform. One is, you know, a data analytics platform that's going to be able to bring us, you know, into the world of value-based payments in terms of reporting to managed care organizations and accountable care organizations. So, you know, I think, you know, with putting some parameters around what our needs are, I think we could probably rule out some of the electronic health records that just won't meet our needs, even though they might be cheaper.
Thank you, Jay.
Any further discussion? No more further discussion? All in favor?
Aye.
Opposed? Carried.
Thank you.
Thank you, Jay. I got one more for you. Resolution modifying the 2020 budget for community services for funding from Research Foundation for Mental Hygiene, RFMH, Oasis, New York State Opioid Response Grant. Do we have a motion? Ms. Kern Perkins is the guy that seconds it. Go ahead, Jay.
All right, these are a combination of SOAR monies from year 1 and year 2 that were not utilized, and if not used, we're going to be given back to the state to be put into a pool for future projects and programs. So we reached out to Oasis and they approved the use of the remaining SOAR monies for year 1, year 2 for us to purchase an electronic health record. And additionally, a portion of this $222,000 will also be used to offset the part of the salary and fringe for one of our current certified recovery peer advocates that's working in the community.
Any discussion? Mr. Akers, go ahead.
So Jay, in the second resolution, the funding for that electronic health record is included in that, is that correct?
Yes.
Okay.
Yes, the $191,970.
Okay. So, and that's, you have not, now that we've given you permission to submit an RFP or ask for one, that's your estimate of cost then, Jay?
Well, we don't know. I mean, we originally were funding the salary and the peer at 100% with SOAR money. So what we did was we reduced that amount to just cover the revenue gap. Right now, you know, peers are reimbursed about $18 every 15 minutes. And, it's not only our department, but statewide, people have been struggling, with that rate to make a pier sustainable without, there being, a cost to either the agency or in this case, the county. So whether or not, given the state financial burden right now, they'll change that rate. But we opted, instead of paying for the full salary in Fringe, just cover the revenue gap, and then use the remaining monies towards the electronic health record. But, based on the two demonstrations and estimates that we had gotten in January, we'd be, pretty close to be able to having it paid in full by the SOAR monies.
Okay, the number was so specific, that's why I was just asking that question. I understand. Thank you.
Yep.
Any more questions, Jay? Any more discussion? All in favor?
Aye.
Opposed? Carried. Now we have an update from you, Jay.
Yep.
Regarding the clinic update.
So I think we missed last month, so I'll go through this month and mention some of last month's numbers as well. As you can see, the no-show rates dipped down a little bit this month. In parentheses, it says there because of the call reminder system. I think really that has more to do probably at this point with providing remote services through technology, that people aren't having to travel. That's certainly helping, enhance engagement and retention in services. In terms of clinic counselor visit averages, for all clinics, we're at 5.34. In August, we were at 5.37. In July, we were at 5.36. So we did take a little dip in the average number of visits. And that is because the number of visits seen by the chemical dependency counselors dipped a little this past month. So moving to the chemical dependency visits per 7 hours, the average from the 8 clinicians was 4.6 this month. However, in August, it was 4.8. In July, it was 4.7. So there was a little bit of a dip. It's my understanding when talking with the program director that in part, I believe there was one counselor that was running behind on some of her notes. So that may have accounted for some of those that didn't go to billing. And then I believe there was a scheduling issue with another counselor. So, those will be handled at the supervisory level moving forward. Mental health, the visits per 7 hours, again, kind of bumped up a little bit. In August, we were at 6.47 for the average, and now we're at 6.85. So in terms of the weighted visits, chemical dependency counselors are at 58%. Again, the goal is 72%. So we have a way to go. When I say 58%, that's the average for the month of September. In August, it was 60.3. So again, it's down 2.2 points because of those issues. On the mental health side, the average amongst those 4 clinicians was 76% face-to-face. In August, it was 71. In July, it was 74. So they are pretty much meeting the expectation. The prescriber visits rose slightly for this month to an average of 9.51% of visits per 7 hours. In August, it was 9.43, and in July, it was 9.4. So a little increase, but for the most part, running fairly steady. We continue to not have quote-unquote wait lists for chemical dependency or the mental health clinic. However, for the mental health clinic, I think we were booking out approximately 3 weeks for a first-time appointment. And now we're at 3 and upwards to 4 weeks for a first-time appointment. So that's a little concerning. In addition to that, we're having a little trouble getting, having available time in the clinician schedules to perform what they call the 5-day follow-ups. Those are OASIS regulated, mandated services that we have to provide follow-up to individuals coming out of an inpatient psychiatric facility within 5 days, 5 working days of their discharge. So, you know, we're looking at that on the mental health side. I know the program director has been fielding more crisis calls and has been doing, you know, more intake so that we don't have as much of a wait time. So services provided for the clinics, as you can see, the trend is, you know, continues to go upward in terms of numbers served, individuals served. You know, we're at a high for the year of 713. The units of service went down a little bit from June, went down 37 units, but, you know, we're continuing to increase the number of people served. And the last category is bills versus paid percentages. And as you can see, we're actually going a little bit in the wrong direction in terms of this past month being at, or excuse me, not this past month, there's a lag here. So we're looking at April at about 80%. And one of the things that happened was, or I should say, one of the things that when I came on board, one of the things we weren't capturing in terms of billing was an add-on for psychiatric appointments. So there's an additional code or a modifier that you can add if a psychiatric prescriber, could be a nurse practitioner or a psychiatrist or an MD, sees someone for a medication management appointment, but instead of it being a 15-minute appointment, it's a 30-minute appointment. So if we put an add-on code for that, we get an additional $75 for that 30-minute session. And for a 45-minute session, which we don't do a whole lot of, would be an add-on of $117. So for a 30-minute with an add-on is about $209 for a 30-minute session. For a 45-minute session with the add-on, it's $251. What happened was, for whatever reason, IMA either billed for both add-ons or they billed for the 45-minute add-on rather than the 30-minute add-on. So we had to, or they had to rebill quite a few services. And certainly those services that we got paid for, particularly if we got paid for 2 add-ons, we had to give those monies back. So, you know, we're trying to work through this. You know, this was something, it was it was an IMA issue. But that is one of the things that is probably affecting, you know, some of our percentages in terms of what we're getting billed or what we're billing for because of having to rebill for a lot of those services. So I don't know if there's any questions.
Rita Curran, go ahead.
So you're saying we do 15-minute appointments, 7.98 at the most visits per day, which is a little bit over 2 hours worth of patient contact in an 8-hour day. Right?
I couldn't hear you, Ms. Curran.
I said, you're saying 15-minute appointments. So on the mental health side, the person who's doing 7.98 or almost 8 appointments a day is having about 2 hours of patient contact. They're not the same people that are behind on their records, are they?
Yeah, I'm still not fully hearing you, but a lot of our prescribers are doing 30-minute sessions rather than a 15-minute sessions and then billing for the 30-minute add-on, if that's what you're asking.
Yeah, I guess I'm just trying to figure out, maybe the EHR that you have now is that bad and it takes that long to document, but hopefully the new one will help.
Any other questions? Yes, go ahead, Mr. Burke.
Jay, not related to the productivity report, but I did want to ask and congratulate your department on that, on obtaining a $900,000 grant for the taxpayers of St. Lawrence County. And I wanted to ask you who was responsible for submitting that grant. I mean, I think it's a wonderful accomplishment.
Well, it was community services with the support of the planning department, namely Heidi Ames. Also, she kind of, we submitted it, she went through it, and then I did the final corrections. So it was like a 3-stage process.
How competitive was it, Jay?
Well, I was told there was approximately, for all of the justice grants, there was approximately 1,500 applicants for 100 awards.
Very impressive. Thank you for the work, Jay.
Thank you.
Anything else? No questions? Thank you very much, Jay.
All right, thank you.
Move on to Vacancy Review Committee. You want Cindy to
Sure.
present?
So this
Cynthia?
is, I think she's, yep, there she is. Hello again.
Hello again.
Go ahead.
Okay, so the first position that we have tonight is it's for a senior social welfare examiner, and this is due to a retirement. So this position is very important because it ensures mandated deadlines for processing applications and recertifications are followed. This position ensures errors are not occurring that may result in large repayments back. It is also each month we have 432 temporary assistant transactions. About $1,200 in SNAP transactions occurring, 1,200 of them, sorry, I can't read my own paper. In each month, so this person, their supervising of this person also is important they help interpret the federal and state and local policies that go with this. So I'm asking that we can get this position filled immediately. Want me to continue?
Yes, go ahead.
Yes.
Okay. Okay. So the next one we have is for a social service caseworker, and this caseworker is for CPS. So there's a difference between the CPS caseworker and just a caseworker. So this position investigates allegations of abuse and maltreatment, ensures the safety of children by providing the ability of the CPS to maintain its high standards set by the department. Each caseworker must complete a face-to-face contact with the family within 24 hours of each phone call, as we discussed earlier. The average caseload has increased. It's almost between 20 and 30 at this point. It was up to 24.1 as of July, but that's increased now. This open position is added to that increase. Please keep in mind when considering this position, the cases are becoming more complex on a daily basis due to the opiate crisis. So that's why we are asking, this position became vacant due to a resignation. The staff actually moved to a different department within our county, which is nice. But we are asking to backfill this position as soon as possible. Then we have one more position as a caseworker. And this position is assigned to work with children and families identified by CPS due to the potential of high risk for neglect, abuse, and maltreatment. This position provides preventative services to children and families to prevent the out-of-home placements to begin with, a definite need in this department. This person works with the high-risk families, continually assessing to ensure the children are safe and not at risk, links families to our community services, monitors compliances of the orders, making sure that we remain in the compliant with the court, making sure that the orders are completed. The average caseload for these caseworkers is 13 to 15. And with this caseworker, the training is the one where it can take up to 6 months to get them ready to go. So these staff are very involved in ensuring that serious injury or fatalities do not occur in our county. So I'm also asking that, and this position also became vacant due to resignation. The caseworker hadn't been here for that long, and she just realized that this type of work just wasn't for her. So I'm okay with that, but you know, I'm asking that we also fill that caseworker, that we're able to fill that immediately as well.
Any questions on any of the three of those positions? Go ahead, Mr. Forsythe.
Thank you, Cynthia. When you say not that long, how long was the person there? Any idea?
I believe that she was, I believe she was here less than a year.
So she was just almost trained, almost. Okay, thank you.
Yep.
No more further questions? Is that Tony's your hand up? Okay. All right, thank you, Cynthia.
All right, thank you.
Next on board is Jay, Community Services. Go ahead, Jay.
Yes, this is a vacancy authorization request to abolish our office manager position along with a keyboard specialist and to create an administrative services manager. So we've been, or I've been probably for 2 years now, you know, and not just me, I mean, you know, other people that are familiar with community services, you know, thinking that we really needed kind of a higher level position, you know, in the office to not only oversee all the operations that are involved with the customer support, you know, in the front desk, but also to oversee and have a point person being responsible for the entirety of the billing process. You know, in addition, you know, to those responsibilities, you know, if we issue the RFP and we do transition to a new electronic health record, this person would be assigned to be the project coordinator of that transition to the new electronic health record, which is really no small task. I've been through at least 2, maybe 3 transitions, and you know, you have to run, you know, both EHR simultaneously, and you have to transfer the data and so forth. So, you know, there's a lot to it. And it's a process, and, you know, you have to have someone who's going to, you know, have the skill and mastery over the new electronic health record to try to implement that within the department for all the other users. So that's one of the reasons, you know, and then also just, you know, the billing practices, you know, have become, you know, increasingly complex. You know, I'd like someone to kind of spearhead negotiating, you know, some new contracts with some of the payers. You know, with the, as Mr. Burke, you know, mentioned, you know, with the COSAC grant, the federal grant that we just received, you know, since the fall of 2019, you know, we've got $1.6 million in grant monies that are brought in the community services. But as you know, it's easy to get the money, so to speak, you know, but then you have to implement and execute the grants, but then you also have to do precise reporting requirements in order to keep in good standing, you know, with the grantors. So they would be responsible for that. Again, you know, developing, you know, reports for higher level data analytics for, you know, reporting to managed care organizations. You know, then also then just overall general supervision of, you know, the office staff, the keyboard specialists, and the account clerk. In terms of dissolving the keyboard specialist, Right now we're providing predominantly, almost, 95% remote services through the use of technology. And it's really kind of changed, the way we're doing business. And one of the things, obviously we don't have a lot of foot traffic, so they're not, the keyboards aren't checking people in like they used to. A lot of the clinicians, or all the clinicians, are managing their own schedule now because of having to, put that into their Zoom rooms or their Zoom meeting schedule. So that would be something that would be very difficult for the front office staff to do. As before COVID, we were just, putting them into the electronic health record. So the scheduling requirement, the burden of that has been, for the most part, fairly removed from the front office staff. The foot traffic has been removed. They still continue to field phone calls, receive faxes, upload labs and things like that into the electronic health record. So, they're still very busy, but we just don't have the need, moving forward. And I really don't see it changing, because I think, providing remote services is going to probably go beyond COVID because of, the decrease in, the barriers to treatment that you have when people have to physically travel, to make their appointments, rather than either pick up the phone and or get on their smartphone and have a Zoom meeting. So I think, not just me, I think, the state, the state is also thinking that, this is something that's not going to go away. We're going to continue to provide remote, teleservices. So in that case, I don't see us having an immediate need, for an additional keyboard. So, and then since my time here, I've been here a little over 3 years, I'm looking at my 4th office manager. And I think, previous turnover, I think that also contributes to some of the, the instability that, we had in the past at community services. So, I really feel, that it's kind of a timely ask, for a higher level position. The office manager is a grade 22. The administrative services manager is a grade 30. But if, you abolish both of those positions, there is still a $27,000 savings to the county.
Any questions? Go ahead, Mr. Akers.
I support the move. I was just wondering, do you have someone in mind? You got, the expectation is 30 days. Is it a civil service test requirement in that position also?
Yes, there would be a civil service test. And I don't think that test has been given in quite a long time. So anybody that would come in would probably have to risk being provisional until they successfully pass the exam.
So the other thing that you mentioned, it's not in the detailed justification, but you mentioned about negotiating contracts with providers. That's a fairly high skill. I don't know if you would get that for $58,000 plus all the other tasks.
Well, we're going to try.
I agree. Is that what other community services enterprises are doing? Something similar, or are we inventing the wheel here?
I think in terms of negotiating contracts, eventually, once we move into value-based payments, if and when, that's going to be done, at more of a network level. But, I do think that we have, 2 or 3 payers now that, we could certainly try to improve some of those contracts, even before we move into value-based payments.
Okay, thanks, Jay.
Yes.
Any other questions of Jay? Thank you, Jay.
Thank you.
Andrea, I think you're on next with 3 different positions. Go ahead, Andrea.
All right, thank you very much. Good evening. We have a lot of movement going on within our department due to some promotions, which is always a great thing when you have really wonderful staff who deserve a chance and an opportunity to move forward in the department. But what it creates, as you all are aware, is, a backlog. So we have a backlog right now where we really need some more people in the office, especially because it's Medicare open enrollment, which I think everyone knows is one of our busiest times of the year. So what we're looking to do with the first one is over the past few years, the State Office for the Aging, during our audits, has noted that our staff members who perform our nutrition assessments really need to be of a higher grade. They need to be at a higher level. So what we'd like to do is this advocate worker position is due to a promotion to a senior advocate worker. So we'd like to abolish one advocate worker and create and fill a senior advocate worker. This would allow us to work this person in a higher level, more of a case management level, which is the services that they are doing for our nutrition staff, our nutrition clients, I mean, where they go into the homes and they perform the assessments, they do follow along duties. So it's more in line with the duties of the position. This is a 100% funded position, so there is no county cost.
Go ahead with the other two, and we'll ask at the end if there's any questions of any of them, Andrea.
Okay. So the second one that you have is a create and fill a temporary keyboard specialist. Due to the inner workings, the movement within the department, as well as what is going to be a long-term medical leave for one of our long-term staff members. We are looking to create and fill keyboard specialist. And again, this would be 100% funded with our New York Connects funding, and really just get someone in to help us with our call volume. It already increased about 35-40% during COVID, and then certainly during Medicare open enrollment, as well as the winter months. Once heat opens on November 2nd, again, it's time for us. We're having trouble keeping with the call volume. So creating this position as a temporary position kind of fills in those gaps would really help us. And last but not least, I would like to fill one of the other vacant advocate worker spots. This is really more an entry-level position to come into our office. This person performs casework within our nutrition program, as well as some crossover with our New York Connects program, which is our entry point to services. So when you call and say, I'm looking for these services, you get one of our New York Connects staff. So we do cross-training there. So it's a lot of flexibility. And this position is within our 2020 budget.
Any questions of Andrea? On any of the three positions?
Yes.
Go ahead, Bakers.
So Andrea, I was wondering, like the position as a senior worker for the elderly or advocate, why is that covered 100% and this one is not? Just out of curiosity.
It's just how we've been actually trying to spend out some of our New York Connects funding, as well as you may recall, we received about $318,000 in stimulus funding. So we were able to move some money around to cover other positions. So that would be why. It's adding a position for us technically. So we wanted to take one away, and we were able to, with the duties of cover it with a full cost.
So what you're saying is you can't have a fund balance, so you had to expend it?
Well, we have to spend it or we lose it. So unfortunately, it never goes to fund balance for you guys. I apologize. Yeah, with our grant funding, if we don't spend it, we lose it, and we potentially don't get it the following year, the same allocation. So we always try to make sure we spend every last dollar.
There goes Jim Reagan's fishing money. That's all I want to say.
Sorry. Can't help you out here.
Other questions of Andrea? Thank you, Andrea.
Thank you very much.
Next up is Dana. She has
Hi,
4 positions.
Yep, the first position that we have is to do a new position as a keyboard specialist. And this is to be created because of the load that we're seeing just in the EI program. The caseload there has been enough for a new service coordinator that we brought forward last month. And so the support that goes to that program just as necessary. Also, all the calls that we have in our department due to COVID-19, this would be helpful as well. For the position number 2, it's for a temp for the public health aid. And this is to help with contact tracing and to manage the school database that we have now that after the 48-hour time period, the schools contact us for those kids that need to be followed. And then on the second part of that is the person who is in that role right now too, doing just her retirement in May. So there are some job responsibilities to fill a gap for the immunization program. That would be the focus of that second one. For the third one, for the senior account clerk, for the person that we have kind of in line for the position 2, she's already taken the test. She would be leaving that senior account clerk role. And so we would need to fill that again. So that is not an added position, but we would have to fill that just if we choose the person who is currently in that role to take the temp role. The last position we have for our department is the secretary 1, and that person is going to resign at the end of the month. So we just asked to fill that position, and that is the main admin support just for the EI program.
Any questions of Dana on those 4 positions? No questions? Thank you. Thank you, Dana.
Thank you.
Next, tentative budget review. Ruth?
So for the Services Committee, there are 7 departments which largely comprise of approximately $86 million in cost of the $249 million in appropriations. And certainly looking at the department budgets for these 7 departments, you have 3 of the smallest and 3 of the largest. So you've got Veterans, Weights and Measures, and Youth Bureau with modifications very modest this year. And then you've got Community Services, Public Health, Office for the Aging, and Social Services. So significant differences, but likewise, the overall impact of all of their net changes this year is $41,000. So I'd say that's pretty impressive. So looking at each department individually, there's one area that I'll ask Cindy to speak to when we get to Social Services. But going back generally speaking for a moment, I did want to cover, just because typically there are questions associated with what we call risk included in the budget. In times like this, as many of you have read my budget message, understand, we don't know what next year holds, and we're doing our best with all the variables included to budget the best we can with the information we have now. We have made a $1.9 million reduction in contingency going forward, recommended for 2021. There are 4 areas that you typically see: energy, overtime, vacation buyback, and fund balance policy that are held level for 2021. There are 3 areas that we've reduced. Compensation, as I mentioned in the first meeting, we have settled 3 of our contracts, so that tremendously helps the reduction there. But you did see an increase in the overall 100s where those salaries are now distributed. Also in capital reserve this year, and I'll go over that in just a few moments, we've made a reduction of $90,000 for a reduction from $700,000 this year in capital reserve to $610,000 for 2021. So an overall decrease, as I mentioned, of $1.92 million. I have included this year, recommended for some technology for the Sheriff's Office as the Sheriff moves through police reform. He's looking at body cameras. He is providing some equitable sharing towards this purchase. A lot of research, I think they're trying out some right now, you may have read about, as well as in the police reform discussion he's holding. Also, there's a need for the print shop, which is our central printing for the county, our efforts to reduce outside printing costs, to replace that piece of equipment, and that's a significant expense. Also looking at the overtime, essentially coming in flat. As I indicated, we're looking at some shifts in costs. We've seen a reduction in the clerk and the road patrol, but you've seen a slight increase in overtime set aside. And for those of you who may not be familiar with the overtime set aside, about 6 years ago, the overtime discussion occupied many of the meetings of the Board of Legislators. So the interest in trying to get a handle on a number of areas where overtime was incurred ensued. And in the budget process, we undertook a measure that provided for the request for the department to be included at 75% in their budget line in the department. And 25% of that request was moved into contingency, and in many cases requires a spend, depending on the department. However, what it did also prompt was an opportunity for the department to come and speak to the Board of Legislators about the current issues, about the incurrence of overtime, and it also, for example, in social services, it used to be overtime wasn't budgeted. However, understanding that vacancies at that time were funding the overtime, the budget team took a look at it and said, if we know we're going to incur that expense, we should have it live in the place where we're spending it. However, 25% of that allowed the opportunity for members who needed that to come back, the department to come back to the board and request that additional spend. Now, in some years, and even in one resolution you considered last month for emergency services, they may exceed what's set aside for that 25%. And in that case, the portion that's set aside is moved across, if the board approves, as well as some untargeted contingency funds. So really the idea being a conversation is prompted, a second look is taken at that overtime spend, and we've seen a decrease over the years with overtime. So that is what we're looking at in terms of the contingency account. The untargeted contingency this year was budgeted at $700,000. We've reduced that to $550,000 for 2021. And then for capital reserve. So in terms of the long-term planning, for many years, as you'll recall, when I think some were talking this evening about the borrowing that took place for a number of years, we weren't able to invest in our infrastructure, in our facilities. However, through a number of both governmental services staff and facilities, buildings and grounds, our superintendent has put together essentially what is an evolving 10-year plan for each building that combines for a total spend. If we were to do everything tomorrow, that number today is $4.2 million. However, spread over and prioritized over 10 years provides the opportunity in this year for approximately a $650,000 spend, depending on the numbers as they come in next year. As we all know, many of the projects we looked at this year, the price of materials increased significantly. And so we were able to look again at it, also in a time where we weren't certain about revenues coming in, and prioritize those for future years. That's what happens in times where it's challenging and you aren't able necessarily to complete all of the projects. So for this coming year, each of the buildings will have some attention, ranging from $127,000 in the new courthouse area with things like elevator maintenance, conversion of steam control valves, things of that nature, to as little as $10,500 related to roof repairs and other panel changes of electric panels. So some of those things I think were neglected for a number of years. We've been able now for 4 years to invest in contingency, to apply those as work, and most of the time in-house labor will allow. What it also requires is when a plan's pulled together, the superintendent or governmental services will come forward and request those funds to be moved to the department for their use. So it keeps track of what we're doing. I think it also keeps track building by building of the responsibilities that we have and the opportunity to address them as time will allow. Certainly some areas where when things need to be repaired, such as the boardroom, many of you will remember not that long ago, we have to respond to those. But our efforts are to mitigate how often that occurs. So those are the two areas in the general sense that I wanted to highlight, but also wanted to, if I could, in a very modest budget year for social services with change, an overall change in appropriations of $1.2 million and an overall change in revenue of $1.3 million. So for all practical purposes, flat. But if I could have Cindy speak to one of the areas that we've taken a look at, certainly it's gotten a lot of attention this year, is foster care. And Cindy, since her arrival, has taken a very serious look at this and also complemented that by working with Colin in fiscal to make some potential limited for 2021, but for some potential risk associated with cost reduction. Cindy?
Can you hear me?
Yes.
Okay, so what we did was we created a spreadsheet, well, Colin did, an amazing spreadsheet. And what we did was we took the number of kids in care. And then what we did was we looked at a 1%, a 2%, a 3%, 4, 5, all the way up to 6.5% of a decrease of kids in care and what that would look like as a savings for the department and the county. So for example, if you take, our current budget at a 5% decrease, which would be 14,500,000, and we decrease that by the 5%, it would end up being a total of 9.26% savings to the county. Now, if you look at that, because you have to look at, decreasing kids is also going to decrease revenue. So you have to, work through all that. It ends up being a 63% reimbursement rate. But if you look at the if we could work at the 5%, 5% would equal 1 child out of institutional care and 11 children out of foster care. That, again, is a 9.26% savings to the county. If we got up to 6.5%, that would be a 10.28 cost savings to the county. It would also increase the reimbursement rate. So the higher we go in kids, of course, the broader everything is more expensive, the reimbursement rate is lower. The less kids we have, the reimbursement rate's higher, the less cost it is to the county. To me, looking at a 5 or 6%, that is extremely doable as long as we have the supports in place to do that.
So I think one of the things that we talked about from a budgeting perspective is the priorities that the department is taking a look at. One of the things that we don't control, even looking at the numbers over the last 5 years, are the number of kids going into care. And while we have to respond to that, we also thought it would be a measurable look at the risk we could take associated with decreasing. Now, I think the number, Cindy, was 24 kids in care right now, institutional care, is that correct?
Yes.
24. So even looking at 1 child moving out of that extremely expensive care, I think that Cindy's background lends well to taking a look at these things and being involved at that level. And I think that's something that we can monitor and bring back to you on a quarterly basis and say, no, we've seen a volume jump of 15, 20%. We're not going to meet those standards, or we've been able to address that, and we're seeing the numbers decrease as well. So there are areas of risk, like I talked about, and that also is a reason that I spoke to the contingency piece before. Also, I think looking at it from the unknowns next year, it's an opportunity for us to know that now that we've built our financial health back into place, we have some room whereby if we needed to address these numbers, come back to the board and say, you know what, these numbers are not what we can handle budgetarily, we need to look at fund balance. Those are areas programmatically where I think having the attention to it, having some of the staff and the infrastructure supports may be helpful in actually decreasing cost to the county. So that's one of the areas of risk. Certainly. Any other questions for social services right now?
Straight.
Cynthia, who makes the assessment of what kids end up in institutional care? Is that made by a judge? And is it out of our control?
Not necessarily. What happens is the judge will basically tell us that we have 24 hours to get this child in care because they want to make sure that child's safe and not back at risk. So then what happens is we get people searching for an open bed. Sometimes that bed's in an appropriate placement. Sometimes there's no beds because our foster homes right now are saturated. So we end up, the only bed we can find is in Massachusetts, or the only bed we can find is, way down south past Albany. So those are kind of some of the things that are happening. We also talked about, getting our assistant caseworkers more involved in kinship and making sure that we have lists of these family members so that we can call them on an emergency basis. But it's all this time that we need to prepare for these kids going into care. It also depends on the level they need. Sometimes they need more intensive support. So what will happen is they'll end up in a scenario that is, it's more support than they actually need, but once they're in that home, it's hard to get them transferred over to another home because there's just not time. They think that person's safe right now, so they're going to focus on somebody else. And next thing you know, 3 years go by. Oh, let's get this kid out, this child out of there. So I think there's a lot of dynamics involved, but I think that there's a lot of ways that we can, fix, our system internally, definitely to make it better.
So you mentioned 11 kids, that the savings would be if you took 11 kids out of foster care. Would the effort be towards movement of adoption? I mean, I know an individual that's had this baby since 2 or 3 weeks old, and the child is now 5 years old, and now they're able to adopt, but it's taken 5 years. Would that be part of the effort?
Oh, definitely. We're working on that right now because there should be a 6-month review and then a 1-year review, and then there should be determination at that point if that child should go, if the parental rights should be terminated and that child should go for adoption. It should be made at that time. Otherwise, the child has no permanency. It's taking too long for these children to develop that permanency. So we are looking at it seems like there's a lot of processes that we're looking at that I'm talking about, but there are a lot of processes that we need to fix here, and we are working on, bits and pieces of all of them. We're trying to kind of draw a diagram of from point A to B and where are we falling off the tracks. So what can we do in that scenario to fix that issue so we can keep going? So there are a lot of things that we're working on, and we are definitely working on them diligently. We have conversations about them every day, and we've already got a lot of practices put in place.
Thank you very much.
Welcome.
Other questions for social services right now? The other piece I would just mention relative to social services, as well as the personnel associated with these departments, is an increase in the overall budget of 8.02 positions, includes 4.25 FTEs for social services. Also, there's just a modest increase in the hours for the Youth Bureau, as well as a decrease in community services of 3.42 positions. So just on community services for a moment, I think the concern and the monthly reports and a lot of the working knowledge that the board has now associated with community services was about finding that sweet spot, so to speak, about caseload versus clients. And being able to, the problems that Jay spoke to tonight, well, when their caseloads are full, sometimes it's difficult to meet that 5-day requirement upon release from a hospital stay. So there's a number of variables that continue to influence even when we've met the goal we set a while ago. And I think looking at that in both clinics for 2021, vacant positions, one for each, a counselor on each side, were removed. And I think also looking at the 2 positions that Jay's requested to be abolished in tonight's meeting, also then only adding 1 position back, I think one of the things that's been a good part of the dialogue with departments has been when you can speak to letting go of those positions that may not be maximized and used now, but you come back later, you want to be taken seriously when you need the positions, but also be honest about when they're not necessarily at full capacity. So I think that dialogue, the board's been very supportive at vacancy review, as well as on the floor for the discussions about handling those needs as they arise. Many of those factors are not within our control to determine what those volumes are going to look like and staff appropriately. Often we're in a situation where those numbers are skyrocketing, like in child protective, and you've been afforded the opportunity to create those caseworkers, and even in that scenario, 4 positions underneath it for caseworker assistant to learn the position, have supervisors get a look at them, and determine if they'll fill the role. So I think there's been some creative things done with positions that also, for our benefit, has only increased the overall FTE count by 2, or just over 2, for 2021 in the tentative budget. Are there any other questions associated with the departments? I think John has a question there. Bill?
Go ahead, John.
Yeah, I'm not sure where we would do this, Ruth or fellow legislators. But I guess I'm wondering, we heard 2 departments tonight, DSS and the sheriff, corrections, talk about underlying conditions with the drug use, and I think as you look around in the community, I mean we do have some very good providers. The county is certainly one of them, but there's a bigger problem, and I'm not sure how do we ever wrap our arms around this. If you look at the presentations that both the county and St. Lawrence Health Systems presented, they both give a narrative of a problem in St. Lawrence County that seems to stand out in the North Country and not stand out in a good way. I guess I'm wondering, how do we wrap our arms around this drug problem? Where do we begin? Again, just a question. I don't pretend to have any great ideas, but certainly talking about it and planning would seem to be good steps.
Go ahead, Larry, Denise.
Yeah, and I again, I agree with John. We seem to be treating symptoms as opposed to effects. And until we get to where we actually treat the effect, the cause, we're not going to try to get where we need.
Mr. Forsythe.
Rita brought up a point earlier, which I still can't wrap my head around. We lost 4 lives in St. Lawrence County this last week to drugs. We've lost 4 lives in St. Lawrence County during COVID. COVID's taken everyone's attention and turned it upside down. And the drug epidemic goes without flow. Something's wrong. Something's absolutely wrong. I don't know what it is either. But you think about that. We lost 4 people in a week as opposed to 4 people in 9 months. I just can't get it.
Mr. Akers, and then Mr. Reagan. Mr. Reagan first, then Mr. Akers.
Well, I think it speaks to the need to move forward on what we're going to do with the methadone program. I think we keep dragging out the process and not making a decision on moving forward with it. I think our providers, our medical community has said they need this option available to them, and it's important for us to proceed. The current system, the options that are available obviously are not working. We're not just talking about 4 young people in the past week. We're talking about a lot of people over the past year, and an even greater number over the past several years. And I think it's important that rather than continue this endless discussion week after week after week, it's time that this board makes a decision and moves forward at giving this option available to our healthcare providers so that they're able to provide an additional method of treatment that currently is not available.
Mr. Akers.
So Saudi Arabia doesn't have a drug problem, because if you use drugs in Saudi Arabia, they kill you. So they have a death sentence. So there's extremes, and I don't think it's something that we can solve tonight. Obviously, governments have been trying to solve this issue forever. I mean, if you go to, and I'm not advocating this, and Milton Friedman, the great economist, advocates for legalization of all drugs, because they're taking drugs voluntarily and functioning in a manner, and they're actually really not affecting anyone but themselves, whether their health or their job or their families, or it's they themselves. So there's a couple different extremes out there, but we're not going to solve it tonight. And you heard the sheriff said, you're not going to arrest your way out of it. So it's symbiotic of today's culture. I mean, basically back in the 20s, opium and cocaine were legal. Marijuana was too, and then they tried to prohibit alcohol. Prohibition on drugs is not working. It is not working. So you can do what Portugal did, and basically take your resources that you're using for enforcement and actually put it towards treatment. There's a system, and I don't know a lot about it, but I know that it kind of stands out as something that's worked. They don't really have the severe drug problem and addiction that they had before. I don't know, I'm speaking out of turn here, but I think with the methadone, it's very, or not with methadone, but with, we arrested them for an what's the drug?
Meth.
The meth, it's so easy to put together. You know, you can go to the hardware store and the grocery store and you can make your meth. So it's, in the wealthier neighborhoods, they're using cocaine, okay? They're not doing the meth. The meth is highly addictive, cocaine is also. So we're not gonna solve this problem tonight. I don't want to denigrate anybody concerned, Mr. Burke, but I don't think it's an issue that's gonna be solved in the discussion tonight on a budgetary decision, It is worthwhile to think about and to do research, but, it's a huge problem, here in America.
Anyone else?
Yeah.
Mr. Lightfoot?
Well, I can tell you from experience, folks, that the problem isn't going to get solved anytime soon. It's been a problem for probably the past 60, 70 years. And as long as there are people that are willing to make the stuff that people get addicted to, people, for one reason or another, are going to use it. They're going to spend the money, and the monies are just out of this world. I've seen pictures of rooms, not big rooms, but about the size of Ruth's office, full of money, stacked up 4 feet high, from wall to wall, in a drug dealer's hideout, I guess you'd call it. But, the sheriff is right, we're not gonna arrest our way out of it. We're also not gonna treat our way out of it, because there are too many people that feel the need to use these things. So, I'm not saying that we shouldn't be doing something, and I do agree that we do need to make a decision. We have not been sitting on our hands or dragging our feet with regard to this issue. We just got the official notification that the 900,000 was coming our way here on Friday, I believe it was. So don't sit there and tell me that we're dragging our feet. We're not dragging our feet. We can't make a decision, but I think we got to wait and make sure that the money's in the bank before we go making that decision. So if we think for a minute that we're going to solve this problem going forward here in St. Lawrence County, we need to take something because it isn't going to happen, unfortunately. Thank you.
Go ahead. Zach, go ahead.
Okay, I don't want to make a habit of this, but I want to go back to what Mr. Forsythe said because I kind of agree with him. Okay, it's big night.
Catch it, Margaret. I'm telling you, catch it.
Right away, Margaret. Right away.
I'm going all Diane Feinstein on you, okay?
Get your mask if we're hugging.
But people, those two things are related. He brought up COVID and we have to go crazy over that. But, I'm one of these old people that reads the obituaries all the time. I was raised in a funeral home. Mr. Denisha knows. I look at the ages of people dying, and that it's not something, most of the time, it's not something that is natural death. We have a horrible rate of deaths, but people are hopeless and they're out of work. And, we've got so many people right now that are hurting that they think this is what they should turn to. And it's unfortunate. I sat on the bench for 10 years. I know how much stuff is related to drugs. I really appreciated the sheriff saying tonight, we can't arrest our way out of it because we had what we termed frequent flyers. They were there all the time over and over again, but treatment and making the economy work for everybody is part of the solution. You're right, Kevin. We can't solve the problem tonight, but it's something we need to address. Thank you very much.
Anyone else? Well, I'd like to weigh in just by saying one thing, that there's a lot of answers that we don't have, but there are a few that I know of that I think we all agree, and that would be the treatment. The other is we've been seeing our state prisons closing down at incredible rates throughout the state of New York over the last 5 or 6, 7 years. And it'd be just nice if I would see the state legislature, not in our hands, but in the state legislature, increase some of the penalties to these drug dealers who are selling this poison to our children and our families and ruining families. I don't know anybody that is not affected by it. And you got to start putting these people in the prisons where they belong and keep them there as long as it takes to keep them from doing what they're doing in terms of making a great living out of poisoning the children we have that are growing up, and generation after generation and after generation. We've seen what it's done to our county budget. We've seen what it's done to the state budget. It's a very, very serious situation, but not one answer, but a lot of answers. And that would be one that I would suggest. Maybe we should send a resolution to Albany, ask them to increase some of the penalties and some of the people who are selling this product to our children, and also increase the penalties and not let them out after just a year or 6 months or a night. That's my suggestion. Go ahead, Mr. Akers.
Just a comment. So what you're talking about is the Rockefeller drug laws, which have been reformed, but you're also talking about the 3 strikes law. And we've seen who gets arrested, who doesn't get arrested, who does time, who's not. Those have not decreased. Either one of those have decreased the demand for drugs. It's more of a cultural, it could be faith-based, it's a destruction of the family or a breakdown of the family. It's a cultural thing. And I think that's a big ticket to address. But I'm going to respectfully disagree with your assessment that stronger penalties. If anything, the drug laws have made it more profitable for the large cartels and organizations, corporations, or whatever, to provide stronger drugs because they could take up less space and require more extensive and expensive means to deliver those drugs because of the demand of whoever in American society that's actually demanding those drugs. And that's why with the prohibition has pushed people away from beer to whiskey to whatever, from marijuana to cocaine to and crack in our urban communities and heroin. The size matters and the potency matters. We know that fentanyl is being shipped to us from China, and the large part of it, that's what's being made. Hey, let's mess up some Americans. I don't want to go on the China conspiracy, that's a little bit left out, but I disagree with the enhancement of the penalties. It's been shown to not work.
Well, I respectfully disagree with you, but that's okay. Anyone else? Okay, let's move on. County Administrator's report.
So the 2 committees from this evening are located on your Google Drive for budget. If you recall the narratives that we put together talking about the changes in appropriations and revenue, it also includes an organizational chart. We'll have those bound for you next Monday with finance, but operations is in as a group and services is in as a group. Talks about staffing changes. Also the mandates, a few years back, we started including all of the mandates associated with different departments, so you have a little bit better understanding of the requirements and the impact that they have. A few quick things. I wanted to let you know that since we last met, the bids are in on the masks, and so we are getting the totals together. They're working through the process to get a sample pulled together with the imprint of the winning design. And we'll keep you posted on that. After they've been created and we receive them here, we'll work with BOCES to get those distributed to all the school districts in St. Lawrence County. So we're very excited about that coming together. Also, since we last met, we held another meeting regarding sales tax for the city of Ogdensburg. And following that meeting, we discussed separately, Emergency Services Director Matt Denner and I met with City Manager Jelly regarding the hazmat team contract. I believe, without final approval, but we'd like to bring you a resolution to consider to get that contract pulled together for a January 1st start. That is a contract we've had in place over the years with Ogdensburg successfully, and I believe that the tenants in the agreement we'll talk about next week are something that the board could take a look at and consider. Also, we discussed somewhat of the unrealistic timeline regarding the resolution associated with dispatch. We identified some of the challenges they face with equipment, and also talked a little bit about that restructuring board report insofar as how does any of the dollars attached to any of their recommendations actually transfer to the municipality. So they're looking into that as well, whether it's a reimbursement or do they front load the obligation or the endeavor that the municipality is taking a look at. So we'll bring you some more information on that as well. The Canton Human Services Initiative Board of Directors met for the quarterly meeting. Reasonably uneventful, and it was held on site. The financials for the last year were approved. If anyone would like to review those, we can make those available to you. The next meeting will be in December, and the officers for the following year will be elected. And for those of you that may be the first time you're hearing of that, the Canton Human Services Initiative is the group that owns the building out on 310. So that is the board of directors that oversees the operations there and makes sure that the bond payments are made and that any legal activity that needs to occur takes place in the appropriate time frame. On Wednesday, I'll be meeting again with United Helpers. We started a discussion, some of you may remember, pre-COVID in Ogdensburg about some work they were taking a look at. Those discussions were suspended, but we're going to take a look at it again this week and determine what their interest is in moving forward and how things look as far as their interest going into next year. And finally, next week, we have scheduled the Development Authority of the North Country to come in and talk about the potential for St. Lawrence County to participate in a survey of available broadband in underserved communities. So I know that's something their new director, Carl Falcone, will be joining us, as well as Lori Marr, talking about telecommunications, which is something his background is in, and hopefully able to assist our county in making sure that all those areas, particularly with the types of education and work that we're completing these days, to get that fulfilled. Also, City of Ogdensburg manager will be joining us. The third quarter financial update will be provided for 2020. And then we will include, much like we did tonight, the tentative budget for the finance committee departments, go over the areas there, and then take any of the questions that you have. And pending no objection, we'll move forward following that meeting with a public hearing scheduled for the board meeting in November. Questions?
No questions?
Nicole does.
Go ahead, Nicole.
Not a question, but a comment. I know we've lost our finance committee department heads, but Ruth and the services committee people, I just want to thank you for this process of going through this entire tentative budget process. I know the work and dedication that goes into it. I know how difficult it is to look at your department and prioritize what's a necessity and what can go, especially in a time like this. So I just really thank you so much for the work that went into preparing these budgets for us to look at tonight.
Thank you.
Next, we'll go into committee reports. Board of Health, Mr. Akers.
Thank you, Mr. Chairman. Between the talking about the feral cats in Waddington, most of our meetings has been discussing almost 100% the COVID-19 issue for public health, board of health.
Thank you. Mr. Lightfoot, CDP Board of Directors.
The CDP met last month. Their next meeting is the day after tomorrow. But at that time and since then, their weatherization department is back up and running for the year. They had a hiccup with their funding in April through July, where they didn't receive any reimbursements. But this funding now apparently is back to what would be considered normal. They have met and they have some production goals for the year, and they're looking at ways to diversify to get some additional funding by offering perhaps some different services. Head Start program is still recruiting for the upcoming, well, the current school year. They're seeing that as a struggle this year because of the COVID pandemic. And they attribute some of it to parents, still up in the air about what they want to do, keep them home or send them to school. The Head Start program is experiencing some significant decrease in the number of children that they are serving. So hopefully they're going to be able to address that. They have an outreach to parents with school-age children that they are trying to get those numbers back up to where they were in the last year. Their neighborhood centers are, in their words, seeing a return to some normalcy. However, they are only open by means of making an appointment. They do plan to reopen their thrift stores on a limited basis by appointment only. And one of the things that really distressed me was that the Ogdensburg Neighborhood Center that had been located in City Hall for, I'm told, decades, was asked to move out by the city. I've heard two different stories about why they wanted to move out. The first one was that the courts want more room. The second one was that they had food that had spoiled and created a safety hazard, a health hazard, and that they couldn't countenance that in the future. So they were living rent-free in City Hall, like I said, for years. Now they are moved about a block away on Caroline Street to the tune of $650 a month. So it's an added expense for them, by no small means, to have to have done that. So I did try and intercede in that, and no luck. As I said, the next meeting is Wednesday. One other thing that I'd like to point out that really staggered me when I heard about it, and I didn't hear the full story, is between Governor Colton-Pierpont and Kent, they have distributed over 130,000 pounds of food. I wasn't able to get at the time the figures for the Ogdensburg area. But that to me is an amazing feat to have distributed that much food to so many needy people. So I think they're doing a great job. We have a lot of people over there, 130 some people in the CDP that work there that are doing a pretty good job at what they do.
Thank you, Mr. Lightfoot. Let's see. Community services?
So at the last meeting, Mr. Chairman, we had a presentation by United Helpers on supportive housing. The Citizens Advocate reported on updates on their work in Messina and Brazier school districts. We also talked about provider contracts and we had agency updates.
Okay, thank you. Mr. Denisha, Office of Aging Advisory Board?
We last met on Monday, September 14th, via Zoom. Got a good report from San County Public Health on the COVID-19 status. There was quite a lot of talk about consolidation of meal prep sites. And one of the things that's happened, the DeKalb meal prep site is temporarily closed. Folks have moved to Canton. And the Star Lake meal prep site is temporarily closed, and one person in their staff has moved to Illinois. A lot of that is directly related to what I talked about before, lack of volunteers, but also it's inability to get people to. There are 3 jobs that are open right now for assistant food prep folks. Can't anybody take the jobs? So, know someone that's looking for a job, tell them to contact Andrea. But, we need volunteers. But the good thing is, all of the home delivered meal clients, everyone is still receiving a home delivered meal. Good.
Thank you. Good. Mr. Terminelli, do you have a report for the Youth Advisory Board?
I gave a report on our last meeting that we had in September. We have a youth committee meeting this Wednesday, and our youth advisory board meeting is next week on the 29th.
Okay, thank you very much. Old business, anyone got any old new business? New, old, yes, go ahead, Rick.
I have new business, thank you. This is regarding snowmobile parking, potential snowmobile parking. Mr. Denisha did all the legwork on this. In Star Lake, at the solid waste transfer station, they have a long driveway that goes into the place, into the transfer station. And once you get in there, there's a landing or a staging place. At the beginning of the driveway, there's a gate that they keep closed. And after that staging area, there's a fence and a gate that goes into the transfer station. So Mr. Chambers has agreed to allow the first gate to be open in the winter for just for snowmobile parking, loading and unloading, on that road and in that staging area. They'll keep it plowed out the days they're working, and the town of Clifton will keep it plowed out the days that they're not there. I talked to the county attorney, and he seems to think it's okay, that there's no issues there. Just looking for approval from the board or any thoughts on that.
Anyone thoughts, any objections to that idea?
No,
Go ahead.
Yeah, I think it's a good idea. I was approached by one of the, last year before the COVID stuff hit. We were up at the, actually stopped in Thirsty Moose in,
I feel like
Child, you know where that is. And I ran into some fellow snowmobilers from downtown. So we talked about the lack of parking, because there really isn't a lot of places to park. And it is a big economic engine. And so anyway, we got talking about the transfer station. There might be some room there, so I talked to Don and let her go, and they said, yeah, there's. And if you look at where it is, it shows the tractor trailer and the scale of the area. There's room for a lot of parking here. To get folks off the road. The transfer station needs to be secured. So, as Mr. Perkin mentioned, there are 2 gates. There's one out by the road and there's one further in. So during the winter months, the snowmobile season, they'll leave the one out by Route 3 open, and they'll have the one in by the transfer station closed. So there's lots of room. Transfer station folks will keep it plowed out during the 3 days that they're open. And I've spoken with the town of Clifton, and they said they would be, because they plow County Route from Newton Falls to Route 390. They said they'd be glad to swing over. It's only 500 feet. They keep it cleaned up the rest of the time.
Yeah. Yes, go ahead, Tony.
Thank you, Mr. Chairman. I actually know a few folks that were at the Thirsty Moose when legislator Denisha stopped up. They asked me to relay to him, bring your wallet the next time. Would be good.
Some moose are more thirsty than others, Tony.
Mr. Chairman, there are county cars. Is there anything in the budget for county snowmobile for legislators to use? Or is that money all gone towards fishing?
You better ask Tony that. He's the head of that whole operation. Okay, how about executive session, Ruth? We need to go in, and for what reasons?
All categories listed.
All categories? Okay.
Negotiations, litigation, personnel.
Okay, is there a motion to go into executive session by Mr. Fay, and Dave Forsythe seconds it? And all in favor?
Aye.
Let's go into executive session. Karen?